We do have some reading and math assignments as well on this one. I believe we should look at it for now before we start it. Okay, I'll share it with you guys. I'm not pretty sure whether you guys are able to see it on your screen. Give me 2 minutes. Let's share it. Yeah. Are you able to see it? We did this chapter already. It just says a patient is limited to 2000 mils. Remember I told you about 1 liter is equal to 1000 mils, right? What I would do is I will leave this for you guys. I'll leave it on the screen. Once we finish going through our chapter, we'll do this one as a class assignment. Okay? And I'll give you guys time. You will look into it, you'll calculate. Once, same as we do the worksheets, we'll do this one. And wherever you feel difficulty, I will go over with each and every question with you. How is that? Okay? Till now, meanwhile, I'll first send it to you guys in your emails. Again. Stop the share for now and we'll just send it to you guys first for we'll attach it. Your emails. Spreadsheet. Let me send this one to you guys. Compose. Attach. Should be in my downloads maths assessment. And it's math. My recipients are, it should show up in my PAMA. You should send me earlier your email. Hold on. Was it PEMA? Premature, right?
PEMCEE 250.
PEM?
CEE?
CEE?
250.
250.
@gmail.com.
Gmail. ZL14-Day.com. For Nima, yours was and nimahassan62@gmail.com, right?
Yeah.
Yes. Can you guys check whether you got it or not? It shows
Yeah. Yeah. Received a mail.
Nimahassan62, HASSAN. And for your PE, it shows it has been received, PENCE, right?
Yes, yeah.
Your maths assignment.
Mhm.
So that if the screen is not filled correctly, but it would be in your possession. Okay. And for now, let's see which chapter we will. I already kept it here, but because I was going through this, I believe our evolve should also be here. Let's do this. Evolve. So evolve elsewhere. This today, this is urinary retention. I would download it again. Save. Compose. This is chapter. Here I attach this file for you guys. PEMCEE. I don't know why it doesn't show your email ID all the time. PEMCEE
250.
250. I did one time for Nima. Hers always shows up. Yours doesn't show up. I don't know why.
Mhm.
Yes, this one. And then I have and Nima Hassan. I send you the slides as well. Okay?
Okay, ma'am. Thank you.
No worries. Check your slides and we'll go over with. Okay? Just so that you guys know where we are at, where we are. Okay? Urinary retention. So urinary retention, when we talk about urinary retention, we say first thing is elimination, the other thing is retention. Elimination, everybody knows in the morning, the first thing we do is we go to the washroom, right? But before we start with our daily routines, let's again throw some light on things that are not correct. Then we go to the things that are correct. One is urinary elimination, one is urinary retention. Elimination process is using urinals, incontinent, okay? Brief, going to the washroom, using a commode, which is normal. Either a person is going to use a male urinal or a female urinal. Okay? Either a person cannot control his or her urine, they might be in their pants, or they are able to sit on the commode which is at their bedside. Be in the bedside commode, it's like a chair. We put the Varna Care product in it, we remove it, we trash it. Either the person is able to go to the washroom right away. So these are some of the things when we talk about elimination. But at the same time, we also have to remember things cannot go well. If things are not going well with urinary retention, what could be the thing? It is called urinary retention. That means a person is not able to pee. They retain the pee. Normally, for a human being, we have to remember at least, which is nothing if you have not drank or if you are dehydrated. It should be 50 cc's of pee should come out from our body. That's a normal procedure. Let's say our client did not drink well. Let's say he did not eat. But our body also has a process of, that's why we get dehydrated. Why do we get dehydrated? Have you ever thought, if I'm not drinking, so what? Why does it make me dehydrated? Right? Have you ever thought of it? That why do we say drink enough water and if you're not drinking well, you will get dehydrated? Why? Reason, our body has a process, a normal process of eliminating water. And what happens? This water has to come out from our cells. If it's because cells contain water. So what if we don't drink enough? If we are not drinking enough, the water from the inner of the cells will have to start coming out. To make sure it becomes a normal process. And that is why we get dehydrated. Is this much clear? Now, if this amount of pee does not come out of our body, it stays in our body, stays in our bladder. Our urinary system, just like I told you guys, for our digestion, we eat through our mouth, then it goes into the esophagus. Through the esophagus, it goes into the stomach. From the stomach, it goes into the small intestine, large intestine, and then through rectum, colon, anus, it goes out. Poo, right? Same thing with our urinary retention. We do have our kidneys. From the kidneys, the two kidneys are attached, right? It is ureters and our bladder, from our bladder to the urethra, male or female. Okay. When we talk about urinary elimination, we have to think if our client, if our resident or our patient is retaining, it will be in the bladder. Second thing, if ever the kidneys do not work well, he's drinking, we are drinking. If not drinking, but we are providing by an IV site, right? Again, IV is going in the side, it's making our body, we are not dehydrated. But still, he or she is not able to eliminate. Reason? The kidneys do not work well. He is, but the input is, if we are putting an IV on 100 cc per hour, means 100 mils or an hour. In 5 hours, it will be 500 mils. So he should be able to pee. And you see very little pee coming out. Hardly he or she had peed. It means he or she is retaining. And when they retain, the first thing that happens is bladder will retain. Sometimes if it's too much, you will see the bladder is bulged. Like the groin area below your abdomen, it becomes a little bulged. And if you press it, they will say it hurts because it's full of pee. The other thing is people might get swollen. If they are not able to eliminate, they have an underlying issue. The water from the body cells does not come out. It just stays in their body, all organs. You will see their face is puffy, their hands are little swollen, their legs and feet are swollen. So this is when we talk about urine eliminating and urine retention. Retention, either it will be in the bladder will be full, it will be bulged, or the water in our body does not come out, it stays in the cell spaces. Each cell in our body is just like this is one cell, this is another cell. They are attached to each other. But between each cell, there's a small space. That space gets filled into our spaces. And when it gets into these spaces, our cells become so like each organ becomes swollen and we look puffy, our hands look puffy. Normally you will see our hands are not puffy, but if you're not doing well, you have an urine infection, your eyes are always swollen. Have you ever seen if there's an urine infection, we get that under eye bags? Because for us, we are not having a chronic illness, our whole body will not get swollen. The first organ would be under eyes. But for elderly people or people who have chronic illnesses, could be elderly, it can be people who are even young. Sometimes we have young clients, right? But they have chronic illness, they get swollen. Okay. First, we have a picture of what is not right, and then we can think about a picture of being right. You would say, hey, yes, ma'am, you said the bladder is full. Now, how would you come to know how much is there? We have a machine called bladder scanner. It's a portable computer screen. It has a probe. We put a gel. If you ever have seen an ultrasound, it's just like a small ultrasound machine, small screen with probe and some gel. We ask our clients, always remember, client privacy, client confidentiality. We tell them, hey, I'm gonna check your bladder. I'm gonna put some lubricant. We always use lubricant, otherwise it will not work. It can be cold. You'll feel this cold. You will put this. If it's to winter time, we try to put the lubricant in the microwave on the floor, but sometimes we cannot do it. Some facilities do not allow, so you will have to put this cold gel. Hold it. It's just you hold it and press the button. Your screen will show how much. Then you move to the right side, you move to the left side. The highest reading that you will see will be the amount of pee he or she is retaining. And sometimes when you press it, when you hold the probe and you press their uh, groin, their bladder, they start to leak out because they do have pee there. It's all because their muscles, the pelvic muscles, they're not working very, very well as it should. Some ladies who have undergone these surgeries or had many babies. Some people they have more than 4 babies, 3 babies, or even 2 babies. But while they were pregnant, all pregnant women are asked to do Kegel exercises. Just those Kegel exercises, contract your bladder and then leave it. We ask them. We do this to make our pelvic muscles strong so that during our later life, things do not go wrong. But even in some young women, things happen wrong and they're not able to, they sometimes retain or they get incontinent. Some ladies, if it does not matter what age group they fall into, they can't pee. And some of them, while they are laughing, while they are coughing, they like they cannot control it. Some pee comes out. It's just because their pelvic floor muscles are not strong. They cannot control it. The reason being, they do have some underlying diseases. I don't know whether anybody of you have heard about MS. MS is an autoimmune disease. It is very common in Canada. Not only in Canada, but North America. I should say exactly North America. It is not a common disease in Asian countries, but it is very, very common in North America. They have MS, and the first thing is MS makes the body very, very stiff. If their arms are like this, it's very hard for them to fold their arms. It affects the muscles of the body. And these people are the first thing that happens with them is they cannot control their pee. If they are laughing, if they are coughing, some pee comes out. So they are using these incontinence pad so that if it's leaking, they're leaking at least. And MS, it affects all age groups here. You will see a 40-year-old, 33-year-old, they have MS. They have a cure, but at the same time, things happen. And when initially things happen, things are not being diagnosed, or a person is not able to yet group up, at that time, this elimination process and retention process comes. Right? Other thing is now, if again your client is normally doing good, you got in, she's not doing well, you ask him, hello, good morning, it's me, Pima, it's me, Nima. Where, oh, what's wrong? Mrs. Smith, you're, let's say, in a facility. Oh, and they don't sound well. You're not pretty sure. You don't have a record of what and when she peed. Most of the times, because they are retaining, they get confused. Retention is confusion. UTI is confusion. The first effect of on any human being, if a person is retaining or has a infection, he or she will become confused. But because our clients are normally more confused, they are at a low level, they're already like their memory power is not that great, it affects them and we can see the effect. For us, being young, having a UTI, we will feel body aches first. We will not, but we feel like, oh, I don't know what's happening to me today. I feel like a headache. The confusion level is not that bad because our memory is intact. We are able to process each and everything every minute. But because their memory is not intact, it hits them and we see confusion decrease LOC, level of consciousness. Okay? If you see anybody tells you LOC, level of consciousness. Okay? Let's go over with the slides now. Urinary elimination. Eliminating waste is a physical need. Eliminating waste is P. Eliminating waste is poo. But right now, we are not talking about bowel. Bowel means poo-poo. We're talking about pee. Again, when we talk about urinary elimination means GU. The other name of urinary elimination is GU, gastro-urinary system. GI means stomach, gastrointestine. GU means gastro-urinary. For urinary, bowel and PP. For GI, nausea, vomiting also is included. Because when we talk about stomach issues, not only our constipation comes in, diarrhea comes in, but vomiting and nausea is also included. But in GI system, in this GU system, we talk about poo-poo, we talk about PP. The urinary system removes waste products from the blood. I told you, water is carried in our blood. Remember, I told you if you are over last time we talked about fluid, and I told you that normally our blood, our heart pumps 5 liters. If volume overload, our blood, if there's too much retention, it goes into the cells and it is carried by the blood, which becomes difficult for our heart to pump in. People with heart failure, people who are older adults, if they retain, their blood will contain a lot of water. If their heart is compromised, cannot pump out enough blood, they will again heart failure. They become edematous and other things happen. This is removed. The water is removed from our blood. Our kidneys work on it through the urethra out of our body. It maintains the body's water balance. And this urinary system, it maintains the body water system from the blood, from the cells out. When assisting a client with elimination, follow the rules of medical asepsis and standard practices. Whenever you are assisting someone, please make sure you always have a gloves on. You never know, they can have any bug. When you're taking someone to the washroom, make sure you have the gloves on. And I'm pretty 100% sure that Every facility provides us with gowns. Some use and throw, and some use those washable. When you enter into the client's room, does not matter is he or she incontinent, like do they have any infection. It's better to put a gown so that the bugs do not come on your clothes, if ever. We don't know what they touch, right? So gloves and gown should be a normal process for you. Take 2 minutes extra to put on the gown. We don't have to gown it everywhere. Put it in your neck, close it. At least it covers your front area, and you put the gloves on, and you assist them to the washroom. It's very easy. How long does it take? Just tie the knot of the neck. That's it. You don't need to tie each and everything. For a normal person who doesn't have an infection. If I am you, I would prefer to do it because I might touch something. Even outside, I might have touched something. It's not necessary they will give me bugs. In the hallway, there were some bugs. I got it into the patient's room, into the client's room, into my resident's room. So the best thing would be right away, wear a gown, keep yourself, keep your client safe. Safety matters first. Okay? Follow infection and control precautions. Normal urination. Urinary output, the amount of urine a person excretes. The healthy adult produces about 1,500 mils of urine a day. What I told you, an hourly, at least in an hour, it should be 30 to 50 ml. For the whole day, a normal human being will produce 1.5 liters for whole one day. In 24 hours, a normal adult will be 1.5 liters, or you can say 1500 mils. Many factors that affect urine production. Oh, we are right now talking about producing urine, means we are trying to create it in our kidneys. What can be the effect? One is age. Second is disease. If somebody is young or old, is somebody having any underlying issue can affect our urine production. That means it can produce less or more. The amount and kind of fluid ingested. What fluid did you drink? Dietary salt, medications, and other substances like coffee, tea, and alcohol. Remember, when we talk about dietary salt, I have told you guys 110 times, even for your normal life, you should remember this. Salt and water are best friends. They never break down their relationship. Here is salt, here is water. Outside goes the salt, outside goes the water. If you are trying to eat too much of salt and it does not come out of your body, why? That means you are not peeing very well. It stays. When we talk about hypertension, the salt, that's why they ask people with hypertension, oh, when did you pee? Are you peeing normally? Because if he or she is peeing, that means the salt will also come out of the body. Two things are to be remembered. Salt and water are best friends. They go together in and they go together out. And the opposite of this is potassium. When potassium goes in, salt and water goes out. If salt and water goes in, potassium goes out. Why do we need potassium? Potassium is needed for our heart to function. If you have petrol in the car or you have keys, let me tell you like this. This is your key. This is your car. You start the car. If there's no fuel, can you start it? If there's no potassium in the body or there's low potassium, our heart needs fuel of potassium to start, to kick this car in. That is why salt, water, and potassium plays an important role in our normal body function. These things are not added in your start, but why not to understand why this happens? What happens in our body, right? We need to know normal. If I don't know normal, how can I talk about abnormalities? Can you? So this is when we talk about our dietary. That's why diet is very important. People with heart failures, we don't give them bananas. Banana is a rich source of potassium. If somebody's heart is not working well, we give them, it's slow, we give them banana, potassium. If somebody have too much of we don't heart failures, we don't give them. That's why we have to look into healthy heart diet. We look at their diet, what they eat. Foods that we eat provide them with nutrients. Food that we eat provides them with all the minerals and vitamins. And there are medications. The most common medication that you will hear every time is we say water pill. Water pill, the name of water pill is Lasix. 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 Lasix is a hypertensive medication. It is a medication used to reduce blood pressure. Not only blood pressure, but we also use it most commonly for people who have swelling, who have problems with urination. We give them Lasix. Either we give them Lasix by mouth in a form of a tablet, or we give them Lasix in the form of IV. What is the effect of this Lasix? They will pee every 5 minutes, 10 minutes, all the water comes out of their body. That's why I'm trying to tell you what, otherwise, what you have to do with this. Some people you will say, oh, I just gave him a urinal. He's being too much. Is there something wrong? First thing that should come to your mind, asking your nurse is your client on any water pills? So you know why he's being more than normal. My reason of telling you about this Lasix, you might not remember the name like Lasix. Just remember water pill. Why? Because if you have a client who is using too many urinals or is incontinent, you just change the pad, in half an hour he's again soaking wet. Don't you think in your brain, what is wrong? What's going on with my client? Why is he peeing so much? What's the underlying cause? I don't need to know. Can I quickly ask, is your client from the nurse on any water pills? That's why he's peeing too much? Or is there something wrong going on? So remember, anybody who pees more than normal, normally how many times if you are drinking and drinking enough water, alcohol, juice, coffee, tea, whatever, fluids, How many times do we go into the washroom? Not more, like not in 2 hours or 1 hour. I believe everybody goes in 2 hours. But if if you're trying to drink more and more and more extra water, you might need to go earlier. Same thing, if they are on Lasix, they need to go more frequently. And somebody who's on this water pill, sorry, make sure you don't feed your clients, elderlies, with water after 5 o'clock too much. Give them. I don't say don't give them at all. Now you will tell, hey, our teacher told us not to feed anybody after 5 o'clock with water. But try to give them, try to push fluids more through the day than at the night. Why? When it is after 5 o'clock or 6 o'clock or 7 o'clock, you give them too much water, they'll have to go throughout the night peeing. They're elderly. They will not be able to sleep much. So it's better we we make, like, if we are pushing fluids every hourly, half an hour, we give them water, juice. After 5 o'clock, 7 o'clock, don't give them too much coffee, juice. When it's normally the dinner comes around 1800, which is 6 o'clock in the hospitals, facilities, everywhere. So after 6 o'clock, why not to reduce? If I'm giving, I gave 10 glasses till now, I will give 2 glasses. I will push more fluids during the day so that we can go and change the client several times. But if we give them 5 glasses after 6 o'clock, how many times they will pee? They're adults, older adults, right? And if they are on the Lasix, then they will be peeing throughout the night. Urination, micturition, and voiding. Micturition is a feeling when you feel I need to pee. Some people, they only have a problem. They will say, I need to pee now. But you give them a urine, you have a brief on, but they cannot pee. The reason is they do have an urge to pee, but they cannot pee. Again, either their muscles are not working very well or they cannot empty their urine bladder. If ever you are not able to pee, how would you, because you cannot um, insert a Foley, or you cannot do it in and out without doctor's order. Whether you are a nurse, whether you are a support worker, let's put our job description on a side. Anybody who's a nurse or anybody who is a support worker in HCA, the other name for you guys is HCA or a care aide, we call it us. Let's say, how will you help your client to pee? I'm just giving you an idea. What can you do? Your client is on the commode seat or you put him in the washroom. She's telling you, I need to pee, but she can't pee. What would you do? Have you ever thought of something? Anything that comes to your mind that can help them to pee? If ever you're not here, yes? Anybody? No? If you yourself are sometimes having hard time to pee, put the tap on. Let the water run from the tap. When your client is on the commode, pushes, it helps them, it gives them an urge to pee. Keep the right away go, put the tap on. The flow of the water, it's normal for us also. Sometimes you have hard time peeing, right away, open the tap on, you will start to pee. Okay? Urination, micturition, and voiding. Voiding is they void using urinal. Now, briefs, the other name for briefs is attends. Okay? All three terms mean the process of emptying urine from the bladder. Frequency of urination is affected by the amount of fluid intake, how much you drink. If you drink too much, you will pee frequently. If you don't drink enough water or you're drinking less, you might go to the washroom very less. In 2 hours, in 1 hour. Habits. Some people, they have this mindset of they are OCD. I need to go now. I need to go now. I need to go now. They only think about that's also a disease. It can be, it's called obsessive compulsive disorder. In this disorder, some people only wash their hands. They keep on washing their hands. Some people they clean so badly. Oh my God, everything is clean, but hold on, just give me one more. Okay, my dear, sorry about that. The frequency of urination is affected by amount of fluid intake, how much we drink, how often we need to go to pee. Another thing, how about our habits, what our habits are, and available toilet facilities. Is it nearby? Is it far to us? It also depends upon the activity, what kind of activities you are doing. I told you some people, they have a problem with what they have voiding problems. If they laugh too much, if they are coughing, if they stand on their legs for a long time, their job is standing problem. Like they're working and they're not MACDs. All these places where you don't get a time to sit for a couple of hours. Hardly you get to sit. Those things, your work, You're working, and sometimes you just don't want to go. Oh, I'm just working. I'll pee later. I'll pee later. You try not to go pee. And illnesses. So these are the things that affect how often we go to pee. People usually void after getting up, before meals, and at bedtime. This is normal. If I have to go pee in the morning, I get up, I'll go first pee. If we if we are going to the bed, the first thing that we do is before we get in, I will go and pee first so that I don't have to get up during my sleep. Urinary incontinence is not a normal part of aging. When we talk about urinary incontinence, means either you have no control over peeing, it just comes out. It's not a normal. It does not have any effect with aging. It's only the effect on their muscles. Some people, they're aged, but they pee when they need to pee. So, urination, micturition, and voiding. When we talk about this, our observation, normal urine will be pale yellow, be a straw color, or amber color. Now, when you go to the washroom and you ever have looked at it, it will be light yellow to a little dark in the morning. Then it will be like white with some tint of yellowness. But you will see some people, their pee is straw colored, their pee is amber colored, dark red, like dark yellow, very dark yellow. The other colors that you might see will be tea colored. The color of the tea without milk, brownish. You will see pink colored urine with blood, some tinge of blood. You would see green or blue colored pee. You would now think in your mind, what is our teacher telling us, green or blue color? If the patient is on medication, one of the medications we have, Valentine, the patients are on medication, the color of the pee is different. They pee greenish blue. So it also, when you see somebody's pee is greenish blue, it should come into your mind, maybe he or she is on medication. Have you ever eaten beetroot? If you eat beetroot excessively, like a good amount of beetroot, the day you eat it, then when you void, check the color of your pee. Have you ever? No, check it. It will be red color. It doesn't mean that you are peeing blood. Diet also plays an important role on the color.
Yes, like when we drink coffee, then even smell comes.
Yes.
Then the color. Yeah,
So when you
like
are
that.
drinking the fluids, what type of fluid you drink, the color and odor of the pee would be like that.
Mm.
So don't be surprised if you see different things, but you have to observe it. If it's your client, you know he or she has not taken any beetroot. This pink color is reddish pink color is not from the food, it is the blood. But if you know somebody ate something like that, then it's normal. Some people have what you know the color when the sky is blue and sometimes you see a small cloud, white, bluish white. Same thing, bluish yellow. Sorry, whitish yellow, cloudy. Some people have some kind of sediments in it. They have like if you the thread, if you ever remove that small piece of thread and or from the blanket that thing comes off, the fur kind of the same. They have that protein. It's those are proteins, broken down proteins they have. So we say, is the urine cloudy? Is are there any sediments? So we might see cloudy urine, we might see sedimentary urine. Okay. Normal urine is pale yellow, straw colored, amber colored. If you're not drinking well, you had a lot of medications, it might be amber colored. Is clear with no particles in our normally it should not have any particles. Has a faint odor, not that bad odor, but it still please smells. But observe the urine for color, clarity. Is it cloudy? Are there sediments? Odor, what kind of odor it has, amount, how much, and particles. Particles again, you might see some proteins in there.
Is it like bubble type color?
Yeah. Sometimes you will see like when you if you have hand wash, you add water to it,
Yes.
and then when you shake it, you see that bubbly. So they
Yeah,
have
yeah.
that bubbly kind of pee with bubbles. Um, you might see if they have kidney stones, you might see some sand, white sand. It's white, like on the seashore when we have salt, like that thing. It can be that those are called sediments, or sometimes you see like a thread is shed in it. That means they have proteins broken down in their pee. Report clients' complaints of urgency. How? Oh, I feel I need to go pee. Urgency. That's called urgency. Some people will tell you, when I pee, it's just like a burn. It's burning my bladder, burning sensation. Or they will tell you, it hurts when I pee. It's so difficult. I cannot pee. So you have to report all these problems to your nurse. Okay? Bedpans. It's you know when you have a broom and a dustpan, right? It's something like a dustpan, has a handle and is flat. We don't use a plastic. We keep it as a cover and we put it's made of a Care product. Care products are like those bamboo things. So those can be shredded. We put it on top of it, that bedpan, and we give them. We put it on. Tell them, can you please lift your bum up? We put the client on a bedpan. Bedpans are used by clients who cannot be out of the bed. If your client is not able to get out of the bed, we put them on bedpans. Again, either if he or she is able to lift their bum up, we put them underneath, or if they are not able to, you and your co-worker have to turn them on one side, put it in the under their bum, and turn them back. Give them time, put a loose sheet on him, put the head up, because if you are lying them down, they won't be able to pee. If you're lying, can you pee? No. Sit them up, think of making a commode position, and they will start to pee. Okay. Clients with female genitals are use bedpans for both voiding and bowel. Women use the same bedpan mostly, not all the time. They do have female urinals also. This is not the correct information. They use bedpans, yes, for poo-poo and pee-pee. Clients with male genitals use them only for bowels. They use urinal for urinal is a bot. It's like this, and it's a bottle. Let me Google. Maybe first I'll see if your slides have it. No, your slides don't have. Does your book have pictures? I don't have a book nearby me.
There's
Let's
pictures on the website or the one you sent us.
let's hold on. Let's hold on. Let's go on Google. Nowadays everything is available on Google. Why not? I need to stop the share for now. We'll go like this. And no, it's not the correct one. Urinal. One care urinal. Okay, let me see the. Yes, I have a picture here. Hold on, my dear. Hold on to your share screen. Here. Can you see the screen now?
Yeah.
Oh. What did I do? Here. Do you see this? This is called a female. This is a male urinal.
Male.
And now we'll go for a one careful urinal. Female. It's like a bowl. Bowl. Do we have a good picture of
You
it?
can go to images.
Yeah, but yes, that's what I was looking at, but it should show us first. This is a female urinal.
Oh.
This is a male urinal. This is called a hat. See, this is a hat. This is the product that we put in the commode and we make them sit. This is a bedpan. Okay. This one goes in the commode seat. This one goes in the commode seat. This is bedpan. See, it looks like a broom and pan, right?
Yeah.
This is female urinal. Okay. We don't want the price. We want, this is a basin that we give them for washing, brushing their teeth. Okay. These are called Vernacare products. They are made up of like a different paper straw and they go in the macerator for shredding. You don't wash them. Okay. Do you want to look at the pictures again one more time to get familiar with what it is? Or everybody is good now?
Look at them again.
Let's look at them once again. What's the... This is here. This one. So this is bedpan. This is female urinal. This This one is your basin.
Red or poo-poo.
Yes, this one is for, where did this go? Tick, 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 tick.
Oh.
Hold on. Yes, here. This is a macerator. See this machine? You put them in here. This is called a macerator. There's a, on the bottom, there is a flap. You don't touch here. See? You put a feet on it, it will open.
Oh.
Don't touch it. And it will close once you put the product in it. This one is a male urinal. Before, we used to use these plastic ones, then you have to wash them. Now, no more. They go straight away into the macerator. See, you put your feet here, this opens up. And this is the commode. You put it on it's like a chair. There's a space underneath. You put it. Sometimes we don't even put it through that. We just put on that chair. They can go poo-poo in it. This is called bedside commode.
Oh.
The chair should be here soon, but they haven't showed the chair in there. So this normal chair, like a normal chair, it has the shape of this thing, and we put this one there. This is a product of bedside.
Isn't that blue thing the chair?
Huh?
Do you see the blue?
Yes.
That has patient washing.
Oh.
No, up. Come down. That right there.
Yes, this one. See? See, it has a space. We just put it there.
Mm.
And see, she's taking it out. From the back, we take it out and we put it in the macerator. Normally, if you are in a rush, you put it on this space on top. Otherwise, to be on a safe side and not to break it, there's a space from the back. We push this product from the back, it goes in, it secures. This is called bedside commode. Okay, and these are either we call them male urinal bottles, or it's called a female urinal. Welcome, Mr. Amrit. You wanna see? Okay, so this is our urine, male urinal or pee bottle. They mostly say, "Can I get a pee bottle?" So this is this. iPad? Under your pillow. Heating pad. This is another form of hat. This is a hat. Now you would say, how do we use it and when do we use a hat? If you have to collect somebody, if we need to collect pee from our clients, they cannot pee in those small bottles, they can't hold. So we put this on the commode seat and they pee in it, we can put them in the bottle. Okay, let me show you other products as well of this one. This is female urinal again. Hold. If your client is throwing up, we give them throw up bags, or we give them this basin. You put the client's brush, toothpaste, mouthwash in this basin. And it is shaped like a jaw, so you can see the shape of this one. Let me check only this product here on Google. I should I should this, we put all their products in this. Everything goes in this one. This is again a women hat. See? This, you make it, you put it on this one, they can pee inside. There isn't a good picture of this basin. This basin is not this basin. We don't use normally. Now it comes like round one. Okay. Now everyone is good with these products, right? Let's go back to our chapter back.
What chapter number are you?
Hold on, my dear. We are on
29.
29.
Thank you.
And new share. I think we were here, right? Yes. So, okay. You guys are able to see your slides again, right? I will send you the slide later, Amrit. Okay, I already forwarded it to them. So I'll forward it to you later on. So when we come and talk about this one, so report the clients about their complaint of urgency, report of if they tell you, oh, it's burning when I pee, or they tell you it's very painful. So those things you need to report. If you know your client is independent and can walk very nicely to the washroom at night, walk them. But if you are not pretty sure how your client moves, he's new to you and you don't know his or her mobility, whether during the day or night, give them the product. If he's a male, male urinal. If she's a female, female urinal. If she wants to go a bedpan or a bedside commode. Do not take the trouble of putting your client, walking them up. Now, another thing that we can do, if my client is very, very adamant, no, I can't go on this, I need to go to the washroom. They have this psychological that I need to be in the washroom. Remember, I showed you this commode seat. Make them sit on the commode seat. Do not put the Vernacare product and walk that. It's very easy. It slides. It has 4 secure buttons at the bottom. Did you see? You have to secure it before you make your client sit on it. Otherwise, it will move. Once you secure your client sat on it, unscrew, unlock it, and take this chair to the washroom. It goes right away into the commode. It's a bit higher. They pee. You take them out, unlock again, and put them back to the bed. So this also becomes like our wheelchair. Okay? Everybody is okay? Now, bedpans are used by clients who cannot be out of bed. If your client is not able to come out of the bed, yes. Clients with female genitalia use bedpans for both voiding and bowel movements. Clients with male genitalia use them only for bowel movements. This information is a little bit old here. Now I showed you how a female urinal looks and how a bedpan looks. So we can use both things for our females. Standard bedpans and fracture pans are used. So if your client has a fracture, we use bedpans. Fracture pans or slipper pans are used by clients who have cast. If your client has a cast, if your client has a traction, if your client has limited back motion, he or she has a slip disc. If your client's bones are fragile or they have painful joints, osteoarthritis, rheumatoid arthritis, we use bedpans for them. Or if your client has a fracture or undergone any new hip surgeries, we use bedpans. Okay? Everyone is okay till now? Do you want to continue or take some break? It was too much knowledge for information till now. Sorry, Amrit, we'll go over with you quickly in a bit. Don't worry.
No problem.
Do you guys want to continue or take a quick break here?
Take a break.
Take a break. Okay. Let's get back at 10:30 then. Okay? Meanwhile, I will send you the chapter, Amrit. Hold on. This is...
And I can send him the classwork
Yes.
question. Yeah, I will forward it to him.
Thank you.
You're very welcome. Mhm. I think I have to do one by one.
That math assessment?
Yes. You got it?
Yes, ma'am.
And the chapter also you got in your email?
Check my email. No, nothing in the email.
Nothing on your email. Okay, I'll just send it to you. This one. Select.
Ma'am, I can send it to his WhatsApp. Yeah, you don't have to email because
Okay.
Email thing is headache.
Okay, you can send both them. I was trying to email him. You can send both these things to his WhatsApp.
WhatsApp.
Yeah.
Okay. Did you receive Amrit?
You send it by mail? Did you?
WhatsApp.
Oh, WhatsApp. Yeah, I received it. Okay, chapter 21. Yep. Thank you.
You're welcome. I will go and have my breakfast now.
Yes, I was looking. I was looking at you guys. You were like, oh, okay. I think you guys need a break. Or you can come back at 10:30, no problems. Stop the share for now and we'll get back. Don't worry. So Amrit, we were today going over with the urinary chapter. Once we complete, we'll just go with it's very important. It's a very important chapter. At the end, I will review it back. Till now, you also just came in. Yes, I hope everything was fine with you.
Yeah, relative of a close friend. They lives in Abbotsford, so he passed away yesterday, day before
I'm
yesterday.
so sorry.
So like sometimes you go to the place, so like
No, no,
I don't
no.
know
I
what happens
understand.
over there. So
I
I just came back
understand.
last night around 3. I
Sorry
messaged you
about
on the
that.
phone, but then I
No,
realized you will be using your phone for the class, so you might not be
no,
able to see the message.
it's okay. No worries. Sorry about the loss. But we'll go over with yesterday we did chapter we did and today's. I will go
Okay.
quickly over the two things. Okay, no worry about
Yeah.
it. Let's take a break quick and we'll come back. Everybody back? Okay. Let's share a screen and get back. Okay. You can see the screen now, right?
Where is screen?
Oh, my friend. Can you guys see the screen? Mhm. Okay. Now, clients with male genitalia use urinals to void. To use the urinal, the client stands if possible, or some sit on the side of the bed or lie in the bed. Some clients need support while standing. You may have to place and hold the urinal for some clients. If your client, he or she, we are right now talking about males. If he's not able to hold it, you put it, you help them to set up, or you might have to hold while they're peeing. Otherwise, you might have to, while they're standing and peeing, you might have to be at their back just in case they don't fall. Just always ask them to stand next to the bed. If ever they feel weak, they can just sit on the bed, or they can pee while they are sitting at the edge of the bed. Could be we only need a little, we need to help them a little bit with the setup. Remind the clients to signal after using the urinal. Ask them, you can get your privacy, you can pee, you take your time. This is your call bell, give them a call bell next to them, and you can come and you can press it, and I'll come and help you. Putting you back to the bag, and this. Cap urinal, if there is one. We don't use plastic urinals. It's talking all about plastic ones. No more, nowhere ever you will see plastic things. Only plastic we use for a bed pad under, so that when we are putting them back on it, it should not break. Otherwise, no. Not to place urinals on overbed tables. Yes, we know we don't put them on the tables or overhead tables because it might fall down and spill. Empty urinals promptly rinse and clean. We don't do rinsing, we don't do cleaning. We throw them in the macerator. This is only they're talking about the plastic ones. These things do not happen now anymore. So clients who are unable to walk to the bathroom often use commodes. I told you, if your client cannot go to the washroom, but they can't even pee in the bed, you sit them up in the commode. Either they void and the container will hold the VernaCare product, or if they want, you should not put the VernaCare product underneath. Just drive it to the washroom, lock it on the commode seat. It just gets in because it's higher than the commode. So they pee or poo, it goes into the washroom clean. Okay, but whenever you put your client on the commode, make sure the bed is locked, make sure the commode seat is locked at all the four corners. Because if your client is now going on it from the bed, he will hold on the chair and the chair goes back or forth, he may fall, right? So secure the seat properly, please. Okay, the commode allows a normal position for elimination, like it allows them to sit up, provide support, and help prevent falls. Some commodes are wheeled to the bathroom and placed over toilets. I told you, we wheel them to the washroom, then we lock them, they will go and come back. It's It's up to you how you want to do it. Okay. The container is removed if the commode is used with the toilet. If you are using it on top of the washroom, bathroom seat, then you don't put the container underneath. You don't put the water care product. Wheels are locked after the commode is positioned over the toilet. Make sure once you are putting your bed client in the wheelchair in the commode seat, you lock it, then unlock, drive the wheel the person to the bathroom. Once you get into the commode seat again, lock the four sides. A client should never be tired or restrained to the commode seat. We never do that. The client should sit on the commode no longer than 20 to 30 minutes. We normally, yes, we don't give them more than this time, but some 20 to 30 minutes is enough time for them to pee and poop on the washroom. Okay? Urinary incontinence is a loss of bladder control. If the client is unable to pee or he voids without he knows or she knows. Some people have no control. That's urinary incontinence. They don't know when they will pee and they already peed in their pants. They already peed in their briefs. It may be temporary or it may be permanent. It can happen. The basic type of incontinence are stress incontinence, that is dribbling. I told you, sometimes we do have stress because even young people due to stress get this dribbling. Some people have problems with micturition. They do when they laugh, when they cough, they do get some dribbling, some stress, some urge incontinence. Like you want to pee, but you don't, like you're full. You know you feel like you're heavy, but you don't have the urge to pee. So when you have urge incontinence, it does not drive you to go to the washroom. Sit there, put the tap on. When the water flows, it makes that urge. Overflow incontinence, they have just peed, but they want to pee again. They pee slowly, slowly, slowly. Functional incontinence, the body functioning not proper. Reflex, as I told you, our muscles, they get reflexes. Okay, I need to pee. The brain gives them this information, a sense that pee, but they don't get it. Mixed content incontinences, sometimes they can pee and sometimes they cannot. They can hold their pee or they cannot. You see some people, oh, I need to go to the washroom quickly, quickly, quickly. They can hold for 2 minutes and then they can't help themselves. So that is mixed incontinence. If incontinence is a new problem for a client, tell your nurse. But with elderly, mostly incontinence becomes permanent. Okay. Challenges related to incontinence. Incontinence is embarrassing. It's all okay. Incontinence is embarrassing. People feel embarrassed when they have peed in their pants, when they have peed in the brief or in the bed. The client gets uncomfortable. Skin irritation, infection, and pressure ulcers are risk. If things are wet, again, they're at the skin irritation, they're at a risk of skin irritation, infections, and pressure ulcers. Falling is a risk because the client may rush to the washroom. As I told you, they want to rush to the washroom so they can fall and trip. The client's pride, dignity, self-esteem, all three of them get affected. They no more feel that same pride, the dignity, and this self-esteem. Good skin care and dry garments and linens are essential. Once the client goes to the washroom or is incontinent, you always apply APC. APC is a cream. Again, we apply. It's a barrier cream that helps the skin not to lose moisture, and if they get a little wet, it also gives for a small time, it also gives them a coverage from skin breakdown. Sadie, please be quiet. Talk slowly. Failure to provide these is considered to be a form of neglect. If you do not provide them with good skin care, if you don't give them dry garments, if they're bed linens is bed sheet, soaker pad, transfer sheet, if those are not dry, this will be again a form of neglect. Am I clear? Now, again, we have challenges that are related to incontinence. Promoting normal, Sadie, please be quiet. Promoting normal urinary elimination prevents incontinence. If you go and help your client and ask them frequently, do you want to pee? Let's go to the washroom. And you take them down to the washroom, or you give them urinals, whether male and female. It helps with incontinence, and they don't pee in their pads anymore. Because we kind of toilet them frequently. We toilet them, give them a chance to toilet themselves frequently. Others need bladder training. So every half an hour to 1 hour, you go and ask them to sit on the commode or provide them with urinal. That's how we do this bladder training. Sometimes nothing of this helps. We do have to put a catheter in. Nowadays, we don't have those things going on. In just couple of years before, we had to put a night bag and day bag. Then when the night bag used to be removed, it used to be washed with salt, vinegar, and water. No, now we don't do any of these things. Please be aware of it. There's a Foley bag. Once the Foley is inserted, we do put a time and date when it is being inserted. If it's a regular one, it needs to be removed and changed every 15 days. If it's an elastic, a permanent one, so elastic one, it's called elastic, so elastic. It's a permanent one, then it needs to be removed and replaced every 3 months. And this is all done by a surgeon. But normal Foley, nurse does. You don't do anything, you just wipe it if it gets dirty. And when the bag is full, you might drain it. Okay, empty it. Otherwise, you don't do procedure of putting a Foley. That's not in your scope. Incontinent products help keep the client dry. Yes, when we use these incontinent products like briefs, inner pads, EPC creams, triad creams, they help to keep them dry. Caring for clients with incontinence can be stressful. When you're dealing with clients, mostly they pee in their briefs, and it happens frequently. It becomes stressful. It becomes a burnout situation. We get tired. If you have clients who are normally on your side in your assignment, they're all incontinent, always speak for yourself. And you see your co-worker as clients who are mostly independent to one person. This is like uses only urinals when provided. You can always talk to the supervisor. They need to break it down. They need to break down the assignment. They need to fix the assignment. So do not think I'm here to work. I need to get money. They will fire me. No. Speak to talk on behalf of for your clients. Speak to stand for your own self. Okay? If you find yourself becoming short-tempered and impatient, talk to the nurse at once. You can always let the nurse. I changed him a number of times. Unfortunately, I'm so done with it. I'm burned out right now. I can't change. Would you mind helping me? Your co-worker. The client has a right to be free from abuse, mistreated, and neglect. If we are burnt out, that doesn't mean you will show all that anger on that client. It's no way his fault. Things are happening. So what we can do, we can always ask someone else to help. Okay? Challenges that are related to incontinence is you get burnt out easily. It becomes a stressful situation. Bodies get tired. Sometimes we don't want to work. We don't get all those clients all the time. Again, there should be a balance between your co-worker and your patients. It should not be all on one, and it does not happen. Sometimes they don't really recognize it because if new patients are brought in, otherwise it's always an assignment. Everybody speaks on behalf of themselves. But still, if it happens, try and stand with your words. Very politely, very nicely. We don't have to be harsh, rude, or angry. We can always present ourselves in a better way. I just want to inform you that my assignment has been heavy. I see on my assignment there are all who are incontinent, total, or need help feeding. I request your good self if you can look into the assignment between this co-worker and me and fix it. This thing can be said in this way also. Rather you say, on her assignment, everybody is like that. She doesn't have to do this much changes. I have to do it. Right? You see the difference how you present yourself. While you are presenting yourself, please and please be polite, use proper words, be nice. Huh? Yeah. अरे थापियात से क्या करू थी तो क्या लगाऊ था सब don't do that the urinary catheter is a tube inserted through the urethra into the bladder that drains urine. A straight catheter drains the bladder and then is removed. A straight catheter is called an in and out. A straight catheter means it does not have a balloon. This one, your slide this. So when we talk about straight catheter, it does not have this. It's like this. Because a balloon is for a catheter that needs to be secured. But a straight catheter does not. So this goes in. When you blow up the balloon here, it becomes like this inside the bladder, it stays in. But the one that we do a straight catheter, in the straight catheter, it does not need to be fixed like this. Reason, it is in and out. Just you put it and you take it out. The one that needs to be secured, we push 5 ml here or 10 ml. The best way is to secure it with 10 ml of water, sterile water syringe. You blow it here and it goes in all through this way, and inside, when it is inside, this does not allow it to come out. It stays secured there. An indwelling catheter, which is called retention or Foley catheter, is left in the bladder. Again, always whenever a catheter is put inside the client, there is a date when it has been put in. This indwelling catheter needs to be changed every 15 days. We do not keep, or if it's a client is in the hospital, then it needs to be removed before the client gets discharged. Am I clear? A balloon near the tip is inflated with sterile water. After the catheter is inserted, it prevents the catheter from slipping out of the bladder. As I mentioned, once we get in, we see, yes, the urine is coming out. It means it's in the right place. We flush 10 ml, 10 cc of sterile water through the balloon, and it just blows up the balloon, so it secures it. You put a secure lock on their thigh, put it there, and it starts. You don't have to do anything there. Okay. A suprapubic catheter is surgically inserted in the abdomen. I have been telling you this is done by a surgeon. Suprapubic, it is in the abdomen, a hole is made and it goes, because what happens is their bladder has somehow changed from inside due to diseases, or no longer can be used because of too many ruptures, bleeding, or cancers. So we do a suprapubic catheter from the top of their abdomen. Okay. Tubing connects to the catheter of the drainage bag. Catheterization is the process of inserting a catheter, whichever a straight or an in and out. Again, the name for a straight catheter is an in and out. We say it in and out, or indwelling catheter, or a suprapubic catheter. Okay. Look at this. This is the port from where we get a urine. This is the port which we fill in with 10 cc of water. Remember, a 10 cc of sterile water. This is what blows up, and that's the thing from where the whole urine, you get the return. Okay. This is how it goes inside the ureter. This is suprapubic catheter. This one is a picture of a suprapubic catheter from the abdomen, from the top. Okay. It's just that why it's called a suprapubic, because this area of the abdomen is called suprapubic area. Otherwise, the catheter is same, but because it is in the abdomen, a hole is made through the abdomen. That's the reason it's called suprapubic. Okay, and you always have to look around if there is redness, if there's swelling, if there's scarring around this. That's what our job is. Okay, while you give a wash. Catheters often are used before, during, or after surgery. When a client is going for a surgery, we always use a catheter. We, during the surgery, cannot give them a bedpan. We cannot do things. So if a client is going on a surgery for a surgery, beforehand, before 24 hours, before 8 hours or 6 hours, depends what the order of the hospitalist or a doctor is, or an MD is. A doctor is called as a hospitalist, an MD, or a doctor. So whatever he writes an order for how long before and how long after. Some catheters are kept lifelong as a suprapubic catheter or a Foley, but some needs to be removed after surgery. And when you remove the catheter, you call the process for trial of void. Now, we will wait here and see what trial of void means. My client was on a catheter for a week's time. His brain abruptly does not take the command to now himself contract and release. Once we remove the Foley, we do a trial of void. Did he void? How much did he void? Once they void, after voiding, we scan their bladder. This is called PVR, post-voidal residue. Whenever your client pees and you check how much still is left in their bladder with that bladder scanner machine, this is called post-voidal residue. We don't say post-voidal, we say the short form. You will listen from your nurses. I need to do a PVR. Can you get a bladder scan? And a PVR can be done only and only once your client voids. The process is First, your client will void, then you do that's what post means after. Post voidal residue. How much is left over? Normally, if you do a bladder scan, it's called bladder scan. It's not called post-voidal residue. Post-voidal can be done only when you give them a urinal, whether they peed or they had that urge of peeing, you then check how much is left over. And this is done, if this is done for a client when Foley is removed, then we call it trial of void, TOV. Am I clear? No confusions? Everything is going good? Okay. Now, for clients who are too weak or disabled to use the urinal, bedpans, commodes, or toilet, we insert catheters. To protect our clients from the wounds, from the pressure ulcers that are due to the incontinence and that happens due to the urine, we insert catheters. Some clients are heavy wetters and they are very pediatric, like we only have extra small, medium, large. That's the brief side. But you see some people are way too big or their tummy is too big. What can we do? We put 3 pads, but we cannot secure those pads. We have to just, for those kind of clients, the best thing we do is insert catheters. Okay? To allow hourly urine output, if your client is on a strict in and out, maybe we do put catheters. As a last resort for incontinence, catheters do not treat the cause of incontinence. When we say we put an catheter in, it does not mean that the incontinence is fixed. It's not actually fixed. It's only a way temporarily we are getting the urine out. Okay? For certain diagnostic processes, we do use catheters. If you need to get a specimen, urine specimen, and the person pees without notifying you, she's always or he's always peeing in the brief, how can you get a urine sample? Right? So you use a straight catheter, again, in and out. In, you get the sample in the bottle, it's done. Nay. For clients with indwelling catheters means catheters left for a time. Again, indwelling catheters means catheters left for a longer time. These clients, they are at a risk of infection. That is why in any workplace, wherever you work, you need to replace, not remove. The word remove is not correct, sorry. You need to replace the catheter every 15 days, every month, every 3 months. Depends on one of the kinds and order from the MD. Am I clear? Till this? No confusion? Everybody alive? Happy?
No.
Now, I can see, hold on my head, I can see this, what happened here? Okay. Shh. What's wrong? Drainage system. A closed drainage system is used for indwelling catheters. Again, I told you for indwelling catheters are catheters left for a while. We use a closed drainage. There's a bag that has a probe closed and then put in. Let's say your client is on a catheter for a long time. Suddenly, suddenly your nurse or your doctor needs a sample, right? Do you remove the catheter, new, old catheter? How would you get a sample? Any idea what you can think of? This is quite a number of times it happens. My client doing good, everything fine, has a Foley. We just only empty the Foley, but the doctor orders urine sample. Will you get it from the bag? Then how do you get it? Do you remove the Foley? Now what?
Yes,
From the
you have to remove it, take the sample, put the back, the catheter back on.
If it's a suprapubic catheter done by a surgery in the abdomen, is it possible?
and get it directly from the tube, no? You can just bend it and then.
Yes. See what we do. We have scissor-like clippers, which are called kinks. Or the catheter bag has, you will see a blue small pin-like thing, which is useless most of the time. You get it right near the catheter balloon. Here, let me go back to the slide. But here, right away here. This is a two-tube balloon, the catheter. But when we talk about indwelling catheters, has 3 tubes. I think I should Google it and show it to you. It's not the right process. A Foley catheter bag, we can this Google Foley catheter bag. Images. Okay, here. Mark it. See these. This one. Can you see this? I will make it bigger. Baba, close the TV right now. Otherwise, don't make noise, both of you. I have to kind of, this is called a leg bag. This one. Here. This port. This port. This port. Maybe I see a good picture here. Nothing is so clear. Can you see this one? You
No.
kink it here. This port we open up. This port we open up. Okay, it's attached. Once the Foley, whole picture of a person with a Foley should be here. Foley should be here. I can say. Let me look for something.
Are you showing us the pictures? We can't see it.
You guys can see? Oh my God, I did not share it. So sorry. New share. Oh, God damn it. Okay, sorry about that. See, thank you for letting me know. I will go over with this from the front, from the top. I thought you guys are able to see. I'm so sorry. I did not share it, but I'm just talking to myself. Okay. These are the Foley bags. You will see either green color, either this color bag. This, once the Foley is attached, it is attached to these bags. The picture here you see is a leg bag. Leg bags are used for clients who are young and want to go out under their clothes. See this one here? What we do, we empty it here. It has its own pipe. This pipe is connected at the top with a Foley bag. Okay. And here. This one. So you see here this small clipper? This is a king.
Yes.
This whole thing, this one is a Foley bag with a canister. See the difference? You see the plastic box? So this is another type used for some kind of renal patients. This kind of bag is normally used for clients on dialysis. It has a canister. Let me make it a bit bigger bit. This one, when you see, guys, see, it has a canister. It has a canister. Can you see? So we flip the bag a little bit, and then here when it is attached to the Foley, we clip this over here. There's a small hole, plastic wrapper. We unwrap it. We take the fresh urine from there and then put the cap back. With your other bags, see, this is more clear because this has P also in it. See, this is with a canister, and others are like this.
Oh.
This is a simple Foley bag. That's a canister Foley bag. Okay.
Mm-hmm.
The others are leg bags. This is again a leg bag. They have secured it in the bed. This is leg bag, see? And she's taking a sample, connecting it. Kink catheter. This is kink catheter. We call it kink when we put a clippers on. Blue colors, they look like scissors, but they're not scissors. They're clippies.
What will happen if we happen to take the sample from the bag? The result will be invalid?
Yes, not invalid. You had a good question. The urine, we don't wash it, right? The bag will have some growing bacteria. If the person does not have right now when he pees, he does not have infection. But if we got it from a bag, the bag everyday pee goes in, there will be bacteria growing. So unnecessarily, we will give a client some medication or we will put them on a procedure. That's why we don't get it from a bag.
And
We
then
get it from the fresh pot on the top.
okay. So like it's okay to first pee on one container and then
Yes.
get it. Okay.
Then you pee. Okay. Let's get back to our share.
Ma'am,
Huh?
what if we happens to mix our pee with water?
That
How could the
at
result?
least if it's with water, that does not affect it.
Oh.
But it should not be from, it can only be from a Foley catheter bag if it is put right away, new one.
Oh.
Right? I need a sample, he's not being, okay, put a Foley catheter, keep it there, don't take it out. That time it's okay because it's just put in 2 minutes. Not even 2 minutes. That time we can, otherwise no. Okay? So Here I will show you. A leg bag has 2 flaps, and these flaps, they are attached on the top leg and bottom leg, secured here. See this, with the strips and this tube, and make sure you press the Leo lock back again, because otherwise if it's left open, the P will. And this one is attached with these strips, but these catheters, they should show a picture of Leo lock. We call it Leo lock. It should also be here. I would like to show you guys that.
So is it okay to walk with that?
Yes. See,
Oh,
if your client is here, they walk, we put their foley bag like this and walk them. If they don't have a leg bag, they have a foley bag. We attach it to the bed, we attach it to their walker, and they keep on moving. If they're young, they have those leg bags, they can put it under their clothes and see.
But you don't have to keep changing the bag, right? You could just drain it out.
Just drain it out. We don't change the bags. Just drain.
The whole, like, that bag is gonna stay with them the whole time.
Yes, forever.
Is it not gonna get like infected or anything like that?
The urine from the bag does not it doesn't go on the back to the person, because we empty it, and that's why I told you that we change it depends on how long the foley has been. The best thing about the foley is from the bag it doesn't go back to the bladder, because it's always left in the lower. We don't put it upper. If you hang the bag up, definitely it will go back into the, but it's always placed on the side of the bed, on the side of the chair, on the side of the wheelchair. It does not, gravity does not allow it to go back into the so bacteria don't go, they don't crawl. Okay. I could not see. This is a Leo lock, but this is a fancy type. We don't use fancy type. We use, I wanted to show you guys. See, it's always left at the side of the bed, hanging against gravity. Why I can't and see a Leo lock here? What happened? Go, Papa is there. That's that when phone here.
How much will it? If it is only just you need to just
Never,
help,
never.
and then say just a bonding for a meanwhile, how much will it cost? Yeah, can you check that?
Hold on, let me check. I want to show you guys a Leo lock that is attached to, it's a white color lock that we've secured the foley on the thigh. Should better write it. Wasting time is not a good thing. Secure foley locks. I should write /LEEO lock. Let me. See, this is how we secure. This flap is on the leg, and this secures. We put the foley like this. Otherwise, if it's the bag and the foley and hanging, it will move and it will like come out. It can rupture. But once the foley is put on, it's put just next to the thigh on the side of the legs, like this. And then it allows it to stay on one side and through the leg side, so that it doesn't go into our client. There should be pictures of clients with this.
Right now, remove the bridge So how much I need to pay if I $40?
See,
Only for the one.
see. This is a this one is a triluminous andargas. This is a triluminous catheter. We have catheters, straight single catheter. बाबा दरवाजा कर बंद कर, बाबा का दरवाजा बंद करो. तुझे क्या है? तो एज पे बैठी है ना, उठो. This is a straight catheter, has no lumen. These are called lumens. The three things that you see. क्यों कोई? Every time you're crying. These are called lumens. What happened? Just hold on, sorry. So this one that we see a picture here, guys, this is a picture of 3 lumen. A straight catheter has no lumen. These are called lumens. A normal catheter has 2 lumens, like this and this. One, we blow this one, we use it to secure it. We flush 10 cc of water through it and it will blow the tip of the Foley, which will secure. But this one, the one with 3 port that I showed you earlier, we use it if we have to draw urine, blood for dialysis. So there are different types of catheters that are used. Okay? See, and we secure it like this, but there should be a person also happy. See, yeah. It's secured like this on the thigh. These are fancy ones if you want, but everywhere you work, you will find this secure lock. It really looks like this. The flaps from the bottom are removed. It's secured on the leg, and then the Foley catheter is put inside like this. And the joint that you see here, this is the one from where we get urine, if ever we have to get a sample. Okay? Everybody is clear with this? No questions? All good. Let's go back to our sharing screen. New share. And we are here. Okay. Okay. So for clients with indwelling catheters, they are at a risk of infection. We make sure we do not put them above gravity. It is always below gravity. Below gravity does not allow them, does not allow the urine to go back. We do not put these we do not put these catheters on ground. We always, if your client, you're changing the client, please make sure you put it on their bed or you put a towel underneath and then you put it on. Don't put it straight on the ground. So drainage systems. A closed drainage system is used for indwelling catheters. We always use, there's a secure lock, like a thing which is called a closed drainage system. I will do this. I'll show you where it is. That helps not allowing the urine to go back. Nothing can enter the system from the catheter to the drainage bag because it works against gravity. The drainage bag must not touch the floor. This Foley bag, we never put it on the floor. If we have to change or move the person from bed to the chair, or from one stretcher to another stretcher, we always put it at the level on their bed, because we can change the linens. It's okay. That's acceptable. That is infection control policy all over the Canada. The drainage bag is always kept lower than the client's bladder. We always put it low, because if you put it higher than the bladder, then it will work over the gravity, the urine will go back. But we always put it lower against gravity, the pee can never go back. What is in our stomach can never come in our mouth. If we eat and we are lying like this, we throw up. It comes back, because even though we have proper lids in our stomach, then here, but still, the same way, we do not, it works against gravities. Some clients wear leg bags when they are out of bed. Never hang a drainage bag on the side rail. We don't do it on the side rail, because if you are putting the side rail, and the side rail are on at the higher level than the human being lying in the bed, there's a special steel groove like this on the edge of the bed. We hang the poly bag there, or at the bottom there are some grooves spaces. We try to put them, never on a side rails. Side rails are above gravity. Position or cover the drainage bag to reduce the visibility of the bag. We always position them in a way that they're not being seen all the time. Some clients wear leg bags when not in bed. Leg bags are changed to drainage bags. The difference between drainage bag and leg bag is leg bag has only a capacity of 500 to 800 mils. It is a very small bag, like it's just like a width of the hand, so it does not hold too much pee. It is attached with the velcro's flaps. You have to empty these kind of bags quickly, because they only hold 500 to 800 mils. And the regular bags that we use are called drainage bags. Drainage bags are emptied and urine is measured. When you see the bags do have a numbers, do not, when you are doing measurement, do not think, I saw on the poly bag 800 mils, it is 800 mils. It can be more or less, because the bag does not have a proper shape. It can blow up like this, it can blow up like this, it can show wrong measurement. Always empty the urine in the container. With the container has a proper numbering. It is already having measuring glass. It's called a plastic measuring glass. Again, we do not wash them. We use it one-time use, or if your client is on regular use, we use one measuring cylinder. We put a number for it, leave it in the washroom, and we overuse it. Am I clear? If your client is not on measurement, not on in and out chart, we simply grab a urinal, male urinal, empty it in male urinal, and simply put it in a message. So two things. If you are emptying a Foley bag where you need in and out, where you need measurement, you do it in a container with numbers. It's called a measuring glass. Measuring glass, we only reuse if this client is on a regular basis of measurement. We put the name, like name of the room, number of the room with a marker pen before we use it. And we leave it in the washroom. Okay? Some clients who are capable do it of their own, measure the urine and tell you how much it was. Depends what the mobility, what the how oriented your client is. And make sure you empty the Foley bag before it is filled more than half. Once it is filled with more than half, it becomes very heavy and it's hanging, it can blast. Pee can come out. Okay? Always make sure half or less than half we should empty. Or else do it after every end of every shift. Whether 8-hour shift or 12-hour shifts. Okay? If it's not too full. Measuring urine drainage. Empty drainage bags according to your employer's policy, whether they want it. Employer's policy, it has nothing to do with employer's policy. If the bag gets filled faster, what policy will you apply? You have to empty the number of times. If ever the client does not pee much, it's even less than 100 mils, but you still have to empty it at the end of the shift. That is what it applies as employer's policy. At the end of the shift, whether 8-hour shift or the 12-hour shift. Always follow the standard practices. Never use the measuring mark on the drainage bag. The marks that are on the Foley bag, do not use them. They are not the correct reading. It is inappropriate, inaccurate, and unreliable because it is a bag. It can take the shape of the liquid. It's not straight from the bag. Use the see-through graduated cup, which I told you is called a measuring cylinder. It's not a measuring cup, it's measuring cylinder. It has, I think, 1100 is the last mark. 1100, it is this much. The last mark, up you can fill it up to 1100 mils. The maximum. Otherwise, you'll have to add up if your client has more than that. But the Foley bag can 3000 is the maximum a Foley bag can hold. But a measuring cylinder is 1100. Okay, so again, if your client feed 2000, you have to make you have to empty it twice with a measuring glass. For accuracy, read the measurement as close. We always put it at the level of an eye. We always put it at the level of the eye. Make a note of the amount, color, order, and abnormal particles. If you see, this is, oh, I drained 1400 mils of clear yellow urine. This is how you say. 1200 mils of cloudy sedimentary urine. As I said, you would see that white sediments in it. Can be, if the client has problems, kidney problems, stones, kidney stones, you might see some shreds, you might see some protein in it, so you will have to report. Or you might see the urine is cloudy. Okay. Dispose the urine down the toilet. Everybody knows. Accidental disconnections. If the drainage system is disconnected accidentally, tell the nurse at once. Do not touch the ends of the catheter or the tubing. Practice hand hygiene and put on gloves. Please put on gloves. Wipe the end of the tube with an aseptic wipe. Wipe the end of the catheter with another aseptic wipe. Do not put the ends down. Do not touch the ends off after you clean them. Connect the tubing to the catheter. We no more do all these things. We mostly use, there are prepared packages. Life is easy. If you want to make it difficult, yes, you're welcome to do it. But we do have a box. It says what size catheter you want to use, and it's already attached everything. Another thing that I want to throw light on, they're talking about catheters. You should remember all catheters come in different size. What do I mean by different size? Do you have any idea what I mean?
Maybe the different sizes for like different age, like small kids.
Okay. Amrit, what do you want to say?
Like kids and kids, young people, old people have different sizes.
Okay. Let me tell you, a person is 150 pounds.
Oh.
And let's not put in pound, it looks like a person is 70 kgs and a person is 90 kgs, a person is 10 kgs. Right? Or if we see, every human being has openings, and this is just an opening. Ureter is an opening. If you're huge everywhere. Your muscles, arms, armpits, right? So the catheters come in different size. 14 French, we call it French. The size does not say centimeters and meters, it says French. Let's again Google it and I will show you different size. 14 French, 16 French, 22 French. How big your client is and how big the whole of a person is, or the genital of the male person is, we use the French. If your client is teeny tiny, we use 14 French. If your client is a medium person, we use 16 French. But if you put a small size catheter in a big person who is obese, there will be risk. Please be quiet. Please. I don't know whether Rabbi is going to find it yourself. There will be at a risk that there will be leakage. Remember the hole and the pipe. If you are in your home, you have a sink and you use a small pipe, what will happen? Yes, rain will come, but it also will leak, right? Same thing. If the hole and the pipe are not on the same size, it will have either leakage or it will block. Talking about, they should have wrote the size of, so we have different size Foley's. We have 14 French, 16 French, 18 French, 22 French. Some clients, they have prostate cancers. The body has changed somehow. And when we are putting the catheter into the urethra, it doesn't go. It's called a kudo Foley. It is like a wire kind of a thing, which creates a space to get in, and it's like this. If a straight catheter does not go in, we use a kudo catheter. So let's go and check the features of catheters now. Different size Foleys. Different size Foley. Different Foley catheters. Images. And yes, here I go. New share. Hey, you guys. Can you see it now? Huh?
No.
No? What happened? I tried.
Yep. Now.
Okay. See?
Yeah.
A female pediatric, a two-way catheter, a three-way catheter that I told you. And we have yes, see, different latex. Some people have latex allergy, and if you see on this, there is numbers written on there. Shh. Quiet. Right? There are numbers written on it. We'll find a picture, closed view picture. What about this one? How close is no this one? Shh. This picture shows 8 French, 10 French, 12 French, 14 French. If it's 14, it is green. If it's red, it is 18 French. Orange, it's orange. Normally we use the orange ones. So see, a teeny tiny. This one, this one. This is the largest size that we have for a pediatric client. It also shows. Shah. Go inside. Go inside now. I will not pull you. Be quiet then. I am looking for a Kudo catheter. Then why don't you keep quiet? You're studying. Bad boy. Come in. Be quiet. No sound. Shh. Big kid studying. See? Yeah. So they always have a size, and the size will keep them, will be thick over here, will be thick. The top is always the same, but this thing, whole thing is French. How much French? I think here. This is a silicone one. This is called a silicone catheter. You will see this. It has a wire inside. Silicone catheters have wire. I will show you now a Kudo catheter. See, 2 mm, 3 mm, 4 mm. So this is what the thickness will tell you, how thick it is. Okay? YouTube Sadiq, go. I think we should see here. Is this a Kudo? No. This is another. See the silicone catheter? Look at it very closely. Some people are, we have latex free, we have silicone, we have Kudo. You have to see which ones are. Patma nahi hai phone. Okay. See? A Kudo one has no matcha. They are studying. Later you will watch matcha. Wait. Allow me to say matcha without sound. When you blow, here is a good picture of this one. When we put the water, 10 cc's, this goes in this one, and it the balloon. It is how it gets secured inside our ball. It does not come out. When you have to remove, you have to pull, you have to get an empty syringe, you have to pull this water, you have to secure it here on this groove, you have to pull the water, and it will inflate it back, and we can remove it. Okay? The slides, I don't feel they are also, they are, these slides are general, but they don't give good information at times. Because when you're talking about so much, but they should have shown pictures and stuff like that. Anyways, By connect the tubing to the catheter, we have these are now secure boxes. We don't do anymore. We get the ones that are easy to be used, which are already fixed, secure. Discard the wipes and do not put it in regular garbage. This goes in a biohazard bag. Biohazard bag is a yellow bag. Any human product goes in biohazard bags. Any sharps go in sharp containers. Anything that is a blood product goes in red. Cytotoxic goes in cytotoxic bin. Every bin has different, everything has a different bin. Do not mix them. Okay? Remove the gloves, wash your hands properly. The condom catheters. Condom catheters are, they are in a cup. You get the cup. It's like a, you know, the wrap that we use at home to cover our food wraps. It's like a food wrap made according to the size and in the shape of a male genital. We just do it, we cover it, and it goes like a condom. And this condom it is attached to a catheter. That's why it's called condom catheter. Again, pick your right side, otherwise the catheter, this condom will come out. It's attached to, it's a thin catheter. Condom made of that paper. It's not the rubber ones. We just attach it. It comes off if the person moves in and out. So you have to check this quite frequently. Okay. We will check the picture of the condom. I'll show you guys the picture of condom catheter later. So these condom catheters, they're put outside. They don't go in the body. They just they simply go over the male genital organ. Shaha, quiet. So you just put it over the organ and it starts. When they pee, it goes into the bag. A condom catheter is a soft sheath like slides over the penis. To apply a condom catheter, follow the manufacturer's instruction. Thoroughly wash the penis with soap and water. Dry the penis before you apply it. It cannot be used for a female. Other catheters are used for female and male, anybody, but condom catheters are only for men. Condom catheters are self-adhering and are applied with elastic tape. You do not put elastic tape. No facility or policy allows you. Simply self-adhering. They stay. You use a proper size catheter. If it doesn't work, then you put a catheter. Simple catheter. Choline. See, this is a condom catheter attached to a leg bag. Go inside. I'm telling you last time. The condom catheter reports and records the following: reddened or open area on the penis, swelling of the penis, color, clarity, and odor of the urine, particles in the urine. Again, it is a see-through catheter. You can see the surface inside. You can see the skin, the shape, the everything inside through. Bladder training. Bladder training is very, very important. If somebody is on bladder training, it means they, no matter what happens, they have to pee after 1 hour, after 2 hours, after 1 hour. They cannot pee on their own. You are the ones to put them on the commode, and you are the ones to give them a full, urina based on female or male, whatever they are using. You go inside and sit with Baba. Now, I said now. I said now. It doesn't matter. You will go, he will go. Go inside now. You know, when I get angry, I don't see things there. Go. Ba't ka kitulat? Just hold on. So kahit manak siya, load. So while somebody is on bladder training, there is a timing when they need to go to the washroom. They cannot go on their own. You need to sit them. You need to time when the last time the person peed was 12. Next, he or she will pee at 1. Then the order will be after 2 hours, after 3 hours. This is how we bladder train them. This is normally done with people who are freshly going into incontinence or had a surgery. Okay. Some clients need bladder training after an indwelling catheter is removed. I don't know whether Amrit, you were here when I spoke over it. I will repeat it. When we remove a bladder, fully from the bladder, we put the clients on TOV, trial of void. Trial of void is we see if they can pee on their own. Once they pee, we do a PVR, post-voidal residue on them. We get a bladder scanner, we scan them, how much mils is left in their bladder. If nothing is left, that's good. If it is more than 250, that means it's no good. If it's more than 350, we have to put the Foley catheter back. That's the thumb rule. And it's an order from the doctor. You don't do anything, but you only watch and help your nurse. Am I clear? So when you do this bladder training, you will see you might have to do first the trial of void. Trial of void. On trial of void, you might have to bladder scan, do a PVR. 3 PVRs positive for more than 350 mils, you have to put the Foley back. Control urination. Controlling the urine is the goal of bladder training. You must assist with bladder training as directed by the nurse or the care plan. You have to provide privacy and normal position. You do not have to rush your client. Okay? Specimens, samples are collected and tested to prevent and detect and treat people. The doctors order what specimen to collect and what test needed. Most specimens are tested in the lab. All specimens are sent to the lab requiring requisition slips. Some tests are done at the bedside. Random urine specimen. Random urine specimens, they are collected for a routine urine analysis anytime, but we do have urine collection, which is called 24-hour urine. Now you would say how and what is done. You are the ones who will again help. We give them an orange big containers. It's an orange big container. We label it right away with the name, time provided. If it's given at 5 p.m., the next day 5 p.m., 24 hours, you will have to remove it. Now, how would you kind of help if it's a person who's peeing? They pee in that big bottle, right? And it's a plastic red or orange red container that we use. And this, when they pee, is kept under a basin with ice. And once the ice starts to melt, we throw it. You will bring in new ice for this 24 hours. The easiest way is if your doctor would write an order for a Foley bag for 24 hours. It is, but again, I said some people might urinate more. They might have peed more than 3,000. It only has a level how much a Foley bag can hold. That's why in 24 hours they will pee more than that. What we do, we always have a container. आयदा आपको याद है मैंने एक बार क्लास थी यहाँ घर में प्रैक्टिकल था इधर बाहर है ना वो कंटेनर साफ वाला वो इधर ला मैं इनको दिखाऊंगी I do have one here. I had ऑरेंज कलर का है ना जहाँ पर हमारे एक सोप केसेस होती है उस शेल्फ में एक ऑरेंज एम्प्टी कंटेनर है वो लाओ उस पे नाम लाओ 24-hour collection box. I'll show you. See, this is the 24-hour collection bottle. On this, you will write the client's name, will write the time, and this container, open, male can pee, female cannot pee in it, so you have to pour it in there. Or if it's a catheter, then the catheter is attached to this top head. Do you see this top head? And it goes inside this. This container can carry 4 liters of pee. Has more than 4 liters of pee. This container needs to be, it says refrigerate all the time. So how we will put the container in the pee container in the fridge? No. We get a basin with ice, always put it in the ice. Every time we go and change this. And when the 24 hours are done, we send it to the lab. This is called collection of timely based 24 hours. Am I clear? Now, no specific measures are, some urine samples that we collect need no specific, but some would be midstream pee. That means when they pee, ask them to stop. Then first pee is always asked. No, when you pee the first one, we do in the middle. So that's called midstream urine collection. Okay. That's another type. They haven't wrote it. Oh, here, midstream specimen. So when we do midstream specimen, it is done because the first pee is considered to be a little dirty. We do the midstream collection. The specimen, the client is asked to void, then stop, then collect the pee. Again, we cannot hold the container bottle and ask them to sit. It used to be a big trouble. Now, recently, a month ago, they created. I don't know whether in facilities it's out or not. In hospitals it is. The container has a flap that holds it, and it has a big handle. So we put it there. Our client sits, and we can hold it from afar, and we like a long stick comes out. We hold it so that our clients do not spill it. Sometimes our clients used to collect, but because they are old adults or they have shakiness, it used to fail. So we can do that for you. Okay. The client voids into the container until the specimen is obtained. Again, labeling the container, and the date, time, and the nurse signature should be there. So when you're sending, if your nurse is telling you to put it in the lab, you send it for the lab you have to ask her, have you labeled it? Did you sign it? I don't want to go again. 24-hour urine collection. All urine voided during 24-hour period is collected. Urine is chilled on ice or refrigerated. We don't refrigerate, we put it on ice. A preservative is added to the collection container for some tests. We don't do that. No ways it has been stopped and banned. The client voids first to begin the test with an empty bladder. Discard the voided, save all voidings. Whatever they pee, it goes in there. Collecting a specimen from an infant or a child. To collect a urine specimen from an infant or child who is not toilet trained is difficult, so we apply a bag and we collect it there. Okay. Testing for pH. Urine pH measures whether urine is acidic or alkaline. A routine urine specimen is needed. There's a bottle. There are strips in it. We dip the strip in it, and we can see based on the color, we match it with the bottle, and it will tell us whether it is acidic or it is alkaline. It is blue or it is green. Acidic or alkaline. Testing for glucose and ketones. Red is for ketones. Orangish green is for glucose. The strip will show, you don't have to remember. There's green, white, yellow, orange, blue. And when you dip the stick, it tells you the lighter shade, the darker shade, the darker shade, the darker shade. It tells you how much. Is it more than 3 ketones in that small specimen, more than 10 ketones, more than 5? That is how we say this person has been tested positive for glucose in the pee or ketones or has infection. The client with diabetes may have sugar in the urine. When a person any diabetic person, if he has if he has sugar in the pee, it's an emergency reason. If it's in low amount, it's okay. We do also have sometimes sugar, that's called UTI. But if it's too much, a person can go in a state called DKA, diabetes ketoacidosis. That's an emergency. You can go in a shock anytime. Excessive should not be there. So we check the number of glucose molecules in the urine. We check it with a detector. Again, we see acetones. Acetones are also present. These are fat and big sugar molecules that our body cannot absorb. Our body can only absorb sugar in the form of ATP, adenosine triphosphate. If it's any form, ADH or any other form, ketone form, our body cannot consume it. This is not the key and the lock. There's a key and a lock system. This lock only takes ATP key. It does not take. Our body can have sugars in the form of ATP, ADP, or ketones. ADP are very small molecules. It cannot open the door. Ketones are large, big molecules. It cannot open the door. It can only get open with ATP function. So one this ADP and ATP ketones are present. When they are not being used by our body, they get flushed into the urine, and that's how they end up in urine. Okay? And then a person might get confused, might have backache because he's passing out big one. And it's not like you can see that sugar. Big means no. No, it's not visibly by the eye. So be mindful of that as well. Urine is tested for glucose and ketones. The doctor uses the test to make drugs and diet decisions, usually done before meal and after bedtime. So we might put the client on insulin. Testing for blood, sorry. Injury and diseases can cause hematuria. Sometimes blood is seen in the urine. All other times it is unseen. When it's unseen, it is called occult. When it is seen, we can see the specimen. It's a routine specimen sent. And you would say how urine can be from the kidneys, can be from the ureter, it can be from the inside, it gets into the blood. It can also be from the bladder. Using reagent strips, do not touch the test area on the strip. There's a specific place where you hold the strip if you are using the reagent strip. You have to dip the strip into the client's urine, compare the strip with the color chart. As I told you, that color chart gives you a number how much. For accuracy, you have to watch the clock. You cannot leave it for half an hour and you come back. It's only done in 3 to 5 minutes. Because if you leave anything for hours and hours, it will get mixed. It can show weird results. This strip is seen and valid for only 5 minutes max. 3 to 5. Okay? Let's take 5 minutes break. Staining urine. A stone called a calculus can develop in the kidneys, called kidney stone, or in a ureter, called ureter stone, or in a bladder, called bladder stone. Stones, calculi vary in size. Small can be passed through the urine. Bigger ones need to be either broken through the laser or we give medications to break them down. Stone causes severe pain in the urinary system. It also may damage it. Sometimes that is the reason for bleeding, because once they are trying to come out but they are not able to pass, they cause rubbing inside our skin, and our skin mucosa inside is very sensitive. It causes bleeding. That's not a bleeding that you can see. It's very minimum, but it's still in the pee. It's called occult bleeding. Some stones are passed through the urine. As I mentioned, all the clients' urines are stained. Passing stones are sent to the lab to make sure that it has been seen. It can be 1 mm, 2 mm, 4 mm, 5 mm, more than 5 mm needs to be removed by a surgeon. No matter what happens, either a laser surgery or a simple surgery. Ureterostomy, a urinary diversion in an artificial opening between the ureter and the abdomen. It's used when the bladder is surgically removed to treat cancers and bladder injuries. I mentioned there are bladder injuries or the bladder due to some cancers, due to some injuries are deformed. So we have to remove a portion of it or divert. For this kind of clients, we use suprapubic catheters from the abdomen. The artificial opening is called a stoma. This hole that we make in the abdomen is called stoma. Oma means hole, anywhere hole. Ostomy Again, you have a stoma. OMA word in medical terms means hole. STOMA means a hole that is made into the skin. Colostomy, ostomy, urostomy. So, skin hole. Stomas do not have nerve endings. They are made in the skin. They're not painful. But you have to watch if they are very red, if they are blue colored. That's when we have to look for infections or it's falling out, it's becoming dead. Ileal conduit. An ileal conduit is an artificial bladder which is created out of the section of the ileum. We simply, that's a surgical procedure again. They look into the cameras, find out the ileum and put the tube in the ileum. Urine drains from the ureters into the newly created artificial bladder and then through the stoma out. First, we create from the inside a bag because the bladder no more can function or is being removed. So we have to place a bag somewhere because something needs to hold it. Otherwise, if there's no holding of pee, how can he will keep on draining all the time? So if somebody's bladder is removed, we do a ileal conduit. We create an artificial bag. We do it. This is a surgical procedure. We go in, create a bag, and from the bag, we put a catheter in, which works from the outside. Okay. This is an ileal. Picture B is an ileal conduit. Normally, our kidneys goes into the sides and into the bladder, but if ever the bladder is removed, we create this bag here, which acts as a bladder, artificial bladder. Ostomy appliances, I told you, ostomies are pouch that are attached. The skin is, there's a hole created in the skin and then that gets attached to the skin. Again, ostomies have size. Some people have big stoma, some people have small stoma based on the size of the stoma, based on the size of the hole made and the skin wrap. When the stoma is formed, you have to check what size ostomy bag you are applying. The appliance is replaced anytime it leaks because urine can cause skin irritation, skin breakdown, and infection. Provide good skin care. There are two types of ostomies. One is one piece and the other one is two appliance. Two appliance is, it has a ring, plastic ring. First that plastic ring goes on, then the urostomy bag. But mostly we use one piece bag for urostomies. Immediately after surgery, the client will receive care from the nurse. You will care for the clients with outstanding urostomies. Initial urostomies are looked after by the nurses, and later on, you are the ones who will be looking after it. Client assists with care as much. You will assist the clients as much as possible. Elimination is, this is compassionate care, what we talk about. Elimination is very personal and private. Be sensitive to client's feeling. Let your supervisor know if your client refuses care. You are always responsible for the patient's dignity, patient's independence, patient's preferences, privacy, and safety. Your dips. And when you are allowing, if your client wants to pee, make sure you give them time to pee. And if the client is not confused, you will have to step out yourself also, giving them a call bell and saying, once you're done, call me, or I am just waiting outside. We cannot stand with all clients. We have to stand only next to our confused clients. If our clients are not confused, we have to step out, give them time and privacy. Okay? That's the end of our compassionate care chapter. Everybody is okay? Do you want to take 5 to 10 minutes break, or do you want to do the workbook right away? It was too much for you guys. I'm okay with anything. Let's finish it up quickly and we'll wind it up. All good?
Okay.
Okay. Today, what chapters are we doing? It was
Chapter 12 and 13 was that? I'm not sure myself.
I used to mark my book, but I had
Yeah, 13 and 14.
13 and 14.
Mm-hmm.
12, we did it yesterday.
Chapter. Which I believe. 13. 13. Starting your career, right? Let's do it. Everybody ready? Pencils, pens, books, all good? The lengthier your resume, the better it is.
Pause.
False. The letter of application is called a cover letter.
True.
True. Your cover letter should be at least 2 pages long.
Wait, number 2 is false?
No, number 2 is true.
True. Number 3 is false.
Yes. If you email your letter and resume, it's good idea to deliver it as a hard copy as well.
False.
True. If asked, you should tell your prospective employer if you have been fired from a previous job.
True.
True. When filing out online job application, you may skip parts that are unimportant to you.
False.
False. Asking people you know about possible jobs at their workplace is not the best way to find a job.
False.
False. An employer is not concerned about your dependability as he or she may be about you as she may be about your good job skills.
False.
False. If you were fired from a previous job, it's all right to write on a job application that you resigned.
False.
False. When you are being interviewed for a job, it is acceptable to ask about starting salary and vacation time.
False.
True.
False. From the list below, we have to choose as many as correct. Main basic resume styles include
A, B.
C.
A and B. Okay. As you write your resume, which questions should you ask yourself?
A, B, C, D.
A, B, C, D. Absolutely. Sources to help you in your job search include
All of them.
A, C, D, E. Not flyers found on windshields. Okay. Your letter of application should include
A, B, D, E.
A, B, D, E. Okay. In an interview, what is the employer looking for?
A, B, C, D.
Yeah.
A, B, C, D.
A, B, C, D. You can prepare from an interview by
B,
A and D.
A, B, C, D, E.
B, C, D, E.
B, C, D, E.
Okay. You can do several things during your interview to help you set up a job. Some of these are hmm?
C, D.
B, C, D, E, F.
A, B, C,
D, F.
D, F, H, I, J.
Can you say it again?
Apple, boy, cat, dog, fish, hen, ink, jug.
Thank you.
Before accepting a job, find out
A, B, C.
A, B. You have had a job interview. I wish it was C as well. I would love to. You have had a job interview and are now planning to write a thank you note or an email to your interviewer. What points should your note include?
A, C, D.
Apple, boy, cat. Okay. Now, single choice answers. When going to an interview, it would be appropriate to
C.
C.
Where?
Mary Sanders had a job 4 times in 1 year. She does not list all 4 jobs when completing a job application. This is
C.
no, unnecessary information. You are completing a job application. How many references should you prepare to give?
2.
2, 3.
Three.
3.
Always three standard. You are in the waiting area before you interview. What should you do?
Sit quietly.
Sit quietly.
Oh.
See, which type of answer is best in an interview?
Honest and positive.
Honest and positive. After job interview, you should
B.
All.
all four. D. Why is having a probationary period common practice for new hires?
A.
A. Next. Body mechanics. Very, very important for your own self job.
True.
Good.
Oh.
Log rolling. That's true. When you lift more or carry objects,
False.
pause. When lifting an object from the floor, bend on the waist,
False.
pause. By using, you always keep it at the level of your waist, not. By using two or more people to help a heavy, weak, or very old client moving up in the bed, you protect only the client from injury.
False.
False.
Pause. In some agency, a turning pan can be an incontinent pad or a folding sheet.
True.
True.
When transferring a client to a chair, choose a chair based primarily on how comfortable the chair will be.
False.
False.
False. A client lying in bed or sitting up in a chair should be repositioned every 3 to 4 hours.
2 hours.
False.
False.
No.
Standard is 2 hours.
Yeah.
Rubbing of one surface against another is called friction.
True.
True.
The way in which body parts are aligned with one another is called base of support.
False.
True.
False. The skin sticking to a surface causing the muscle to slide in the direction of the body is moving is called skinning.
False.
False. Another name for transfer or safety belt is gate belt.
True.
False.
True.
True. Turning the client as a unit in alignment in one motion is called body mechanics.
True.
False.
False. Another name for a back lying or a dorsal recumbent position is called supine position.
True.
True. That's a supine position. Another name for side lying position is called side lying position.
False.
True.
False. The semi-sitting position with the head of the bed elevated 45 to 60 degrees is called Franklin position.
False.
False. Semi-fallers, not Franklin. Fallers, semi-fallers, high faller. A left side position in which the upper leg is sharply flexed is called Sims position.
True.
True. You put the client on the side and we put the leg up on that. It's called Sims position. Another word for posture is body mechanics.
False.
False. A turning sheet or a pad is called the transfer sheet or a lift sheet.
True.
True. Sitting on the edge of the bed is called edging.
False.
False. Position in which the client is placed on his abdomen with his head turned to one side is called drone position.
False.
False. A chair used to move clients from one place to another is called wheelchair.
True.
True.
You can provide a better base of support for lifting by standing with your legs and feet apart from a wide base of support.
True.
True. This is the proper body mechanics that we use. Providing a good base of support will help to reduce injuries.
True.
True.
When you move a client up in bed, it is important to protect the skin from shaving.
True.
False.
Huh? From shaving? We don't know. It's not shaving.
My up and down.
Friction. So it's false.
Friction.
You should place the pillow against the
Wait.
headboard. Pardon?
Is number 24 false or true?
False.
False.
It's not called shaving, it's called friction. That's why it's wrong. You should place the pillow against the headboard when moving a client up in bed to prevent head from hitting the headboard.
True.
True. The level of the bed should be raised horizontally when the client is being repositioned to reduce the amount of work to the support worker has done.
True.
False. We put it at the waist of our level, not the horizontal.
No.
Horizontal means they will fall. The level of the bed should be raised horizontal. We did this, right? Two staff members work together when raising an older client's head and shoulders to provide some support for clients with fragile bones and joints.
True.
Huh?
True.
Yes. A transfer pad is used to keep the bedding neater and reduce wrinkles.
False.
False. A transfer belt is used on men who have probably fitting trousers to keep them from falling.
False.
False.
False. The seat of the wheelchair is padded to promote the client's comfort.
True.
True. Mechanical lifts are used when a client cannot assist with a transfer.
True.
True.
The number of staff members needed to transfer a client from the bed to chair or wheelchair depends on the client's physical abilities and condition.
True.
True.
The Sims position is the right side lying position.
False.
False. The supine position is back lying position.
True.
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 The prone is difficult for ill clients to maintain. True. They cannot
True.
lie on the face. When is the supine position? Ankles should be elevated on two pillows.
False.
The stroke patient in the stroke position is also known as lateral position.
False.
False. To correctly lift an object from the floor, you should use muscles in your shoulders, upper arms, hips, and thigh.
True.
True.
When working together, two co-workers can ensure they move the client at the same time by
A.
You have multiple answers. A
A.
and C. Okay.
Oh, it's multiple.
Yes. This is multiple response.
A and C.
It is important for a support worker to follow the guidelines for good body mechanics. The guidelines are
A, B, C, D, F, and G.
A,
E.
A, B, D, E, F. Apple, boy, dog, egg, fish. How can you provide comfort and safety to a client being lifted or moved in bed?
B, C,
A, B, C, D, F, G, H, I.
A,
B,
C,
C.
A, C, D, F, G, H, I. Apple, cat, dog, fish, goat, hen, ink. Okay. Log rolling is used to turn.
And specify C.
42. A, B, C, E. Apple, boy, cat, egg. Okay. 43. What observations should you make when the client is dangling their legs?
B, D, E.
Apple, boy, cat, dog. A, B, C, D. Okay. Before using a lift, make sure
B, C, D.
D,
B, C, D, boy, cat, dog. When you position a client, you should follow these safety guidelines.
A,
Mhm.
All of these.
no,
Apple, cat, dog. Fish, goat, hen. Ink, kite. We make sure that linens are free, but we don't tug them. Put a single word changes the whole scenario. Okay? We inform the client, but we don't ask when. Right? So that's why one tricky word changes the whole thing. Apple, cat, dog, fish, goat, hen, ink, kite. What are the benefits of repositioning clients frequently?
B,
D, D.
A and
D.
D,
A,
A, B, D.
A, B, C, D,
A,
No,
B, D.
A, B, D. Apple, boy, dog. A transfer now is one correct word. A transfer sheet or a pad is used by placing it under the client.
A,
D.
G, from shoulders
A. We have only one answer, so it's A.
to
Soles worn by clients being transferred to a chair or wheelchair.
C,
A.
C.
C,
Connected here. I think something happened to my connection. So, anyways, let's go back to this one. When transferring a client to a stretcher,
D.
D.
49D. Yeah. Body alignment is
A.
A. Mr. John Dunlop is turning as a unit, turned as a unit. Which one motion is it called?
B.
B. Log rolling. Mrs. Rennie Nedu has slid down in the bed. Her skin sticks onto the bed while her muscles move down. This is called
Section.
D.
D. Shearing.
Sharing.
When you are giving bedside care, the bed should be C. Level with your waist.
Level with your waist.
Yeah. You need to move a client up in bed to reduce your friction of injury.
D.
D. Get assistance from co-worker. To prevent falls during transfers, you should ensure the wheelchairs or shower chair wheels are
D.
locked and aligned correctly. B. Mrs. Arja Gupta has less strength on her left side. Where should you position the wheelchair?
D.
Next to her right side.
Right.
When you have two more turns on transfer clients, it is best to
C.
follow care plan. Being moving, turning, transferring, or lifting the client, you should always
A.
A. No lift policy means
B.
mechanical lifts are the position in
I think there's no problem.
Yeah.
prone position.
Again, go on.
Yeah. Ma'am, close again.
You will communicate directions by saying, we are moving you on the count of 1, 2, 3, and move together.
You cut out. We didn't hear the whole thing.
I said, first one, the position in which we put the client is prone position. And how can you make sure that you and your co-worker, you always communicate directions? And you're moving, you say on the count of 1, 2, and 3, and move together. Okay? Third one is how when a turning pad or a slider sheet is used, what do we reduce? 1, pain, skin damage, and lifting more evenly and easily. Okay? Okay? Why should you move a person to a side of the bed before turning? So that the person is close to us and we do not have to reach to the other end. When it's closed, we can always do things quickly. We don't have to go back and forth. Why do you pad the seats of a wheelchair?
So it is comfortable.
Yes, to make the client comfortable. When are mechanical lifts used? When
When the client cannot
transfer.
move on its own.
When a client cannot transfer, right? Now there are some positions again. We have to label these. The instruction that is shown in picture 66 is a follows position. Is a first one is follows position. 67, the instruction shown is which position?
Supine. Supine.
The instruction below shows in picture 68. It's a prone position and it's used to prevent ankles. Okay. The illustration that is shown in picture 69, because here it's under the pillow, so ankles are prevented. The next one is again a prone position, and it is at, see, the feet, they are positioned to the edge of the mattress. Okay. What about illustration 70?
Side position.
Right lateral position. Sada, can you get the charger? The computer. इसका लैपटॉप का चार्जर दिला जल्दी जल्दी बंद हो. Right lateral position. Illustration 71. Attach it quickly. आराम से.
Hip, knees, and elbow.
Shoulder, upper arms, hips, and thigh. Huh? Shoulders, upper arm, hip, and thigh. Okay. What chapter? What's the next chapter that we are doing? 28. 28, right? So we'll do the maths one then on Monday. Unfortunately, I don't think so we'll have enough time to do that one today. Okay? Yeah.
Yes.
Done? Huh? We can do. Huh? Okay, let's start. Enteral nutrition. During a scheduled tube feeding, 400 ml is usually given over 20 minutes. This is true.
True.
Formula for feeding tubes should be heated.
False.
False.
False. You remember I told you room temperature? The risk of regurgitation is less with nasointestinal tubes than with other types of tubes.
True.
Important when clients are NPO. Mouth kiss is important.
What's the answer to the third one?
Third one is true. Fourth one is false. An intravenous size on the back of the hand is a central venous site.
False.
False. Support workers should check the placement of the feeding tube before each feeding.
True.
False.
False. False. You don't do that. You should clean the client's nose and nostrils around the feeding tube every 4 to 8 hours.
True.
True. Support workers are responsible for maintaining IV therapy.
False.
False. Notify your supervisor immediately if there's any leaking of fluid from the IV.
True.
True.
Huh?
True.
True. Number 9 is true.
A client should be sitting or in the semi-Fowler's position during the feeding.
True.
True.
Scheduled enteral feeding are usually given 4 times a day.
True.
True. Continuous enteral feeding requires an electric feeding group. True.
True.
When a client is receiving an enteral feeding, he or she is in a supine position for at least 1 to 2 hours.
False.
Frequent oral care can help a client with feeding tube feel more comfortable.
True.
True. The left side lying position should be avoided when a client is receiving enteral nutrition, as this position prevents the stomach from emptying.
True.
True.
Now you have multiple choice answers. What condition may require client to have tube feeding?
A, B, C, D.
A, B, C, D, E. What can cause the feeding tube to move?
B.
Remember I told you coughing also does it? Sneezing yesterday. A, B, C, vomiting, suctioning or pore positioning. Not talking, but A, B, C, E, F. When you care for a client with a feeding tube at home, which of the following is a support worker allowed to do?
B, D, E.
D and E. You pour the formula in the feeding bag and you start after the placement has been confirmed and verified by the nurse. D, E. What should be reported to the nurse if client is receiving a tube feeding?
A, C, E, F, G, I, and J.
A, B, C, D, E, F, G, I, J. No H, everything otherwise. It has nothing to do with room temperature, normal temperature. Okay? A client may receive IV therapy to
A, B, C, D, F.
A, B, C, D, F. What safety measures must be followed by the client having an IV? Hmm? Hmm?
All of them?
A, C, D, E, F, G, H. No B.
Can you repeat that again, please?
Except B, everything. 21. A, C, D, E, F, G, H. Apple, cat, dog, egg, fish, goat, hen. What sign and symptoms indicate that there is a problem with an IV?
A, B, C, D.
A, B, C, D, E. Remember, hot and coldness, infiltration and phlebitis. What sign and symptoms indicate that there is a systemic problem with an IV? Hmm?
All except D.
A, B, C, G, H, A, B, C, G, H, I, K, L. Sada, close it now. Phone बंद करो, उसको दे दो. A, B. Apple, boy, cat, goat, hen, ink, kite, lamp. Okay. Now, which of the following describes a gastrostomy tube?
A.
A,
A. What responsibility does the support worker have if the client is being fed through a tube?
C.
C. Assisting the nurse in giving. Hmm?
Number 25 is C.
Yes, number 25 is C. Clients who cannot chew or swallow often receive nutrition by
A.
enteral nutrition. Support workers are responsible for
D. Providing personal care to the client.
provide personal care to the client. Physicians order IV therapy to
D.
D.
a sign of IV therapy complication is
B. Swelling around the site.
D. Okay. Now, match the followings. You have gastrostomy tube.
D,
Hmm? Gastrostomy goes into stomach. C. Okay. Percutaneous endoscopy, gastrostomy. Peg tube.
E.
D.
E, that's correct. Into the tube, the stomach. Jejustomy tube, J tube.
What is
Jejunum
31?
part of intestine. It will be D.
D.
Nasointestinal tube
Nose.
through the nose into stomach. B. Nasogastric tube.
A.
A, into the stomach through the nose. Now again, IV sites. Peripheral. C, on the back of the hand, in the forearm, or on the crease of the elbows. That's called peripheral. Okay. Scalp.
D.
D, on the head. Central venous site.
A.
A, in the subclavian vein or in the jugular vein. On the bed.
B.
B.
Last. Pick. PICC, pick line. B, in the cephalic. How do these measures help clients with feeding tube feel more comfortable? Hard candy or gum? What does it do? Always remember, hard candy or gum, it relieves dry mouth. It relieves dryness of the nasal passages. It relieves any kind of dryness. Okay? When we talk about hard candy gum, dry mouth, lips, dry lips, cleaning, dryness from nasal, frequent oral care, dryness. Clear? I think there's a drop always in the now getting into the computer, right? So hard candy gum, it will remove, it will relieve dry mouth. Lubricant B, lubricant for lips, relieves dry lips. Cleaning of nose, dryness from the nasal passages, nose, and frequent oral relieves complete dryness. What are the 4 signs of aspiration in a client? Coughing or choking during the feeding, right? Change in the breathing pattern, whether it will be difficult for them to breathe or they will breathe faster. You remember the wet gurgly voice, and then the last is pale and bluish lips. Coughing, choking, coughing and choking during the feed. Change in the breathing could be slow, could be shallow, could be rapid. Wet and gurgly voice, pale and bluish lips. Everybody okay? So tomorrow, not tomorrow, Monday. Monday you would be doing your own one and 2 from the back. Okay? Which is 2 from the back is our, where are we at? From 2 from the back.
15 and 16.
Will be 14. We did 15 and 16, right? 15, 16, and our chapter.
29.
29.
Yeah. This, and then have you guys got a chance to do your maths? Or do you want
Yep.
to do now? What do you want to do? Or
I've
on
done the
Monday?
math thing. Rest is up to you guys.
I didn't even do it.
You didn't. Do you want to do it now, or do you want to do it later? And we can discuss it later. How do you want to do it?
We do it on Monday.
Sure, I don't mind. But if you want to try anything right now, we can also do it.
Okay.
Hmm?
You guys gonna do it on Monday or no? Or right now?
Okay, just take your time to do this. If you feel difficulty, we can always do it again. Okay? So you did get your slides for today's class, and also this assignment, what we will be doing on Monday will be chapter 15, chapter 16, and new chapter, and on top of it, the maths assessment. Okay,
Yes.
so a quick update of what we were doing is we were talking about urinary elimination, which is very, very important. If your client retains, what would be the after effects of it? If they retain, it would be a reason for them to get swollen. If they are dehydrated, what will happen? We talked about this just when we started the chapter, okay? Go over with the slide. If there's something which you need clarification with, do let me know. Remember to see what kind of Foley we are using. I'll always, if your nurse asks you, you need to get, can you please bring a Foley? You always ask, hey, which size Foley do you want and what do you need? Do you need a straight? Do you need which 2 lumen or 3 lumen? Do you need a latex one, latex free one, or silicone? At least you should know what I am picking, what she's trying to, because you don't want to go back and forth. You can always ask if you want to use a kit which is already connected. The one, okay. You only have to do one thing. You have to get, even the sterile water is inside that package. Everything. The sterile gloves, the lubricant, the water, everything is inside that package. Otherwise, you'll have to go back and forth when you have to do you don't have to do, it's not in your scope when your nurse has to do a Foley. If she doesn't get the supplies, if she's not going to get the supplies, if you are the ones, you'll have to go back and forth because you might need a lubricant first or lubrication. You need proper size Foley. You need a sterile water to inflate the balloon. You need sterile gloves and clean gloves. Clean gloves when you are preparing it, and once we insert, once everything is set to do, we change again. We do sanitize our hands because we can go out. We sanitize our hands and we put sterile gloves. For sterile gloves, you should be knowing what size gloves your hand is. Small, medium, or if your nurse wants to get you, ask what size you need. So save your time with these small things. Okay? Any other questions for today? Today was a very, very long class. I hope you guys enjoyed. Okay,
Thank you.
you're very welcome. Any questions?
Bye. Bye.
Bye.
I saying bye. Not yet. We don't have any questions.
You don't have any questions. How about you two?
No.
Not exactly.
Not exactly. Look at your sheet and see if you have. Don't worry. We can come and talk about it on Monday. So please remember that we also promote independence. If they can pee, give them the pee bottle or the urinal so they can hold on to that themselves. Give them time. If they are confused, you have to stay with them. If they are not confused, you no wait. No, not yet mobile. We have to wait. So if they are confused, you have to stay with them. If they are not confused, you have to step out as well. You have to let them know, I'm standing outside. Here's the call bell. Let me know because they need privacy, they need time. Okay? And after, not only we have to wash hands, but if they're even though if they're not holding, but they void it, please give them clean wipes, wet wipes to wipe their hands and wash their hands. If you only wash your hands, but your client doesn't, there is still risk of infection and others being infected. So always we sanitize our hands before we reach hands, but we also ask our clients to use sanitizers on their tables attached, or we give them wipes to wash their hands, wipe their hands. It is mandatory to give them also wipes or sanitizers. Otherwise, again, the risk infection and spread of infection. Okay.
Goodbye.
Hi.
Let's end this class with a goodbye. So see you guys tomorrow on Monday. Bye bye.
Thank you.
Thank you very much. Have a wonderful day ahead.
I have something
Um, Ma'am, I got hold of a couple of things on other student of WCC. So I asked him to mail me what are the requirements. So he mailed me the things which they sending them in the mail for that orientation courses.
What can you go over with them with me?
Yeah, sure. Yeah, they like immunization records, TB
Yes.
test results, fitness
Yes.
certificate, food and safety first aid certification.
I told you, remember? DMS phone. Close the phone and give it. I'm talking. Yes.
They are providing vouchers for food safety and first aid certificate from ProSafe.
Yes.
Okay, and then you need to do violence prevention 1 to 8 certificates.
Yes. Violence prevention from 1 to 8 you will get from Learning Hub.
Yeah, complete point of risk behavioral care from
Risk behavior from the Learning Hub.
And provincial hand hygiene certificate.
That is also from Learning Hub.
PPE, personal protective equipment certificate.
Learning Hub.
And SPECO.
SPECO is also from Learning Hub.
Yeah, plus they also have a PDF.
The other name for SPECO is WIMS.
Yes. Okay. So one they have a PDF. Then it's a physical fitness certificate. like they have a sample of these certificates.
Yes,
See
this
that?
is, I think this is, that's from the Western Community College, right?
Yeah. Yeah, should have like forward this to Maz or Dishan?
You can, but they should just wait, we'll see tomorrow. They should have it.
Okay.
This is standard. They should have it because once you cannot go on the floor. That's what I was trying. I tried to tell you guys, you cannot go on the floor unless you have your immunization record, you have your TB test done, you have your criminal check, you have your food and safety.
Yeah, actually, the person who's doing it from WCC is like he lives to my next basement. So in the evening, he discusses with me a couple of things. So this
Yeah.
was a standard mail sent to him. Yeah.
So you have to get all those, and then with the learning hub, the school should provide you access for now. That access, when you work, you will have to merge it with, you don't have to do those over again. The name and everything remains same, but the merging gives an access to the employer also.
Okay.
I think it's better. We will talk to them and ask
Cool.
them for learning hub access. I am not, so they have though, so the school hasn't yet given you a learning hub access, right?
No, I yesterday asked them like a day before yesterday, like I have been asking for the access code for criminal records. Then the second was list of orientation courses and access code for ebook, whether I have to buy it. Because if I get access code for the ebook, then I don't have to carry the physical book with me. I can get it
Yes.
on my iPad. So it's not been reported by them. It a day before
I
Dishan
remember
told me
I
like,
called last time and they said they're gonna talk. So
but they haven't. That's okay.
I'm sorry about that. But learning hub, they have to give an access. You won't be able to go
Yeah,
on.
you need to have the access code for the criminal record check also. Like,
Yes,
no,
those two things. Those,
yeah,
no, actually nothing until and unless we don't send immunization record, we don't send your criminal check record, all that should go to the facility wherever you're going, then they will allow you for a practicum. They will not allow
yeah.
you to go on a practicum other, but I'm not sure why they haven't why they did not speak to you over this.
Actually, I have like now I'll be going for 15 days, so I won't be able to do anything for 15 days.
I
So
know.
I only get 15 days to get immunization, TB check,
Yes.
everything.
But
And
Amrit, I would suggest you to get your TB test done. It
okay,
You have to do it. You have to do it. If your TB test comes positive, you'll have to book yourself for an X-ray. That's the
okay,
standard protocol. No matter whether the school will tell you when and not, do not wait, because that is standard. Even if you want to work in any facility, they will tell you, have you got your TB? We want the results of the TB test.
yeah. Actually, the mail which I received, like the WCC college is sending to its students, so it makes it should not be not older than 6 months. So plan accordingly.
Yes, but
Yeah,
you have to go, for the TB test now.
yeah.
Otherwise, you will not be able to go on the practicum. Your
Okay,
course is not a big long course, and the TB test, they don't ask you to do over and over again. Never,
okay,
because once they inject this specimen in, you will definitely be positive. So they know, yes, it will come. The first time one works forever then. So
okay,
get your TB test done. If it's positive, do not worry, because you're from India, you get the first vaccine that in India everybody gets. is the TB, BCG vaccine. So you'll have to go for a normal X-ray.
So that's okay, but I went for the TB test around a year back with that chest X-ray, and it was nothing.
Yeah, that's what I'm saying. That's the normal procedure for it. And you will have to go for a blood test. But for that blood test, yes, the school has to give you a requisition because you will not be able to go to the lab asking for.
Yeah,
I
I filled out this requisition from this thing and sent it to my doctor. So she has given me a requisition from now. So I
That's-
might be going today or tomorrow.
Yes, please get it done. If it's the last moment, it takes couple of days. You will
Yeah.
be in trouble, unnecessary trouble.
Yes. Okay. Thank you, ma'am.
You're very welcome. And I told you Learning Hub access. If ever it becomes difficult, you can that Learning Hub you can access from your work site as well. And I can help you if it's not on time. I can help you with the answers. I've already done it long before. I can access it. Don't worry. Okay.
Okay. Yeah.
Take care
Thank
of
you.
yourself. Have a wonderful day ahead. Take care. Bye bye. See you.